Usually on the third day, here we have the most dedicated people who are most interested in research and integrating AI tools in research. And thank you specifically to you, especially to you, because you know what you are looking for. And I will provide you a brief review what we did during the first 2 days. It's AI tools. I will explain what is actually AI world and how it works for research, for publication, for many other things, and how to choose right AI tools, how to develop prompts, then how each tools work, and which of them is right for specific tasks to do. Then we had the next day, the second day, where we have discussions. It was that was very interesting discussions. How we can integrate AI tools in the research, different types of research. What are the drawbacks? How can we achieve most success? What to consider to avoid some difficulties. And we also touched very important ethical issues with Gigapasitashvili and Davi together. We had very interesting overview of the evolution of research methods in biomedical field. And yes, now it's the third day, and we will cover specific topics, and we will start with Veriko's presentation. And Veriko will talk about how to start the research. If a researcher decides to do something new, to contribute to medicine, to contribute to public health, and in general, to contribute to research. So, how to initiate this process? What are the key components of research? And then we will have Avi, who will work with you in groups or individually. All of you have laptops to practice the specific AI tools to make your research easier and to economy resources. Veriko, are you ready?
Yes. Okay, I will try to be. I will try to speak in a way that is understandable for all kinds of professions, and let's see how it will go. So, do you hear me? Everyone in Zoom also? Okay. So, today's topic, content of the presentation, is the overview of the research for health, then about formulating research questions and hypotheses. Then I will do the overview of study designs. Then I have a couple of slides about qualitative versus quantitative methods, and hopefully we will have a discussion. Since the main focus of this entire training conference, masterclass, is the AI. In this slide I used myself an AI, ChatGPT. And for the definition of health by WHO, I asked ChatGPT to generate the image. So this image here is generated by ChatGPT, Avi. So I don't know where to cite it, but it actually quite expresses whatever is in the definition of WHO about the health. It's a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmities. Oh, ChatGPT-'s image. So they are all smiling. We have like world over there in the back, Sunday, and hopefully it's more or less expressed. So we can talk about the limitations of the image, but that's what I used just to express that health is not just the physical well-being, but also mental, social well-being. And then we talk about the research for health. And in research for health, we have different directions. First is measuring the magnitude and distribution of the health problem. And auditorium know that this is epidemiological research. Then we have understanding of diverse causes or the determinants of the problems that can be social, behavioral, physical, environmental, right? Biological, environmental. This can be basic research or clinical research. Then developing solutions or interventions to prevent magnitudes of the problem. Then we can go here into the trials. Then implementing and delivering those evidence. This is already the implementation science, and then at the end we do the evaluation of our intervention at the end or in parallel. So this can be impact assessment, right? A part of the implementation science. Then we have a hierarchy of evidence in research in general. It starts from the case reports, like single reports, and or can be the multiple reports, which is case series. Then case control studies, cohort studies, randomized trials, practice guidelines, systematic reviews, and meta-analysis, which create the highest evidence of research. And now we can speak about the research question. Research question is the thing that actually determines the study direction, scope, and objectives, right? And in general, for instance, if you are interested in infectious diseases, with a research question you narrow down your interest for the particular study. Research question can be exploratory, descriptive, and analytical. When do we have exploratory research question? When we are investigating new or poorly understood areas, right? What factors influence vaccine hesitancy, for instance? Oh, sorry. Yeah, do you hear me now?
Yes.
What factors influence vaccine hesitancy? Then we have descriptive, describes features of a population and the problem, what is the prevalence of diabetes in Georgia? And analytical, which assesses relationship or causality. Does smoking increase the risk of tuberculosis, for instance? Do we have any questions so far? This is also generated by ChatGPT. There are specific characteristics, actually, which must good research questions should have, and this is specificity. It should be specific enough, clarity, clear enough so everybody can understand it, as well as the study group, as well as the readers later on. Relevance, it should be relevant for the particular time frame, population, place. Ethical, examinable, researchability, feasibility, and novel. So I asked ChatGPT to generate the acronyms. I asked ChatGPT to generate the acronyms considering those characteristics of the research question. It actually generated several acronyms. One was a crane, another one was crest, and this one was screen. I chose a screen, so you kind of screen your research question for those characteristics. So again, use of ChatGPT here. Then, just considering those characteristics, I'm giving you the hypothetical example. In my initial presentation here was a fish example, whether should we eat fish to prevent heart diseases. This is the example I usually use with my master's and PhD students. Again, refer to ChatGPT and ask, can you make, considering this, what I'm offering, can you make example different, using the different disease and different determinant? And ChatGPT produced this response: should people exercise more? And the response is, does resistance training, so should people exercise more? It's very generic, right? And then it goes down to the specifics, which is, does resistance training reduces the risk of osteoporosis in postmenopausal women? Yeah.
What does it mean, the resistance training?
Stress training. Resistance training is stress training. So it specifies a specific type of the trainings, specifies the population, target population, which are postmenopausal women, and specifies the outcome of interest, which is osteoporosis. Yes. აი ახლა ისმის მე მართლა უნდა დავიჭიროს ხოლმე.
აი ეს მაგით ისმის და
კი ბატონო. ახლა უკეთესია?
აი ხო ვიცი.
Right. So this is just to show what is the process of creating example of how what is. Can we move this by the way? Okay. Okay. Then about the hypothesis. So based on the research questions, then we create the hypothesis. So what is hypothesis? This is in every field, not in just the biomedical field. It's an assumption, a claim that you test using the data. And essentially, that's right. A testable hypothesis must be specific, have to have empirical reference, and in terms of empirical reference, we know this is the data which should be used to test the hypothesis. And we have two types of hypothesis, which is like in biomedical research, we use two types of hypothesis, which is the null hypothesis and the alternative hypothesis. Null hypothesis says that there is no difference between two groups. In our case, it can be exposed group and non-exposed group. We can formulate it in another way. There is no association between two variables. For instance, no association between smoking and lung cancer or smoking and tuberculosis. And alternative hypothesis, which tells you that there is an association between two variables, or there is difference in two groups. For instance, exposed versus unexposed. This is how we can actually. Just a second, I'm trying to find the point. Yeah. So how we can formulate the null hypothesis, depending on the study type, which we will discuss later, we can say that prevalence of disease in exposed group equals to prevalence of disease in unexposed group. For that we have the cross-sectional studies. For the cohort studies where we can directly measure incidence or probability of the disease, risk of the disease, we can say risk of disease is similar in exposed group versus unexposed group. And then we have the alternative hypothesis where we just say that two groups are different, and this will be like non-directional hypothesis or bidirectional hypothesis, and we can say also unidirectionally one group has a higher incidence or higher prevalence of the disease compared to other groups, or vice versa, right? Any questions so far? So what is the goal of the study? Considering that we formulated the very specific, clear, ethical, feasible research questions, screened it for these characteristics, we already have a hypothesis, and now what we do, we need to test this hypothesis by collecting the data, and for that we need to design a study to obtain the best evidence in support or in refutation of the study hypothesis, right? So, and the evidence we are collecting is constrained by time, resources we have, ethical constraints, and other practical considerations, which I will try to cover later on. But as we are talking for research in health, in particular we are speaking about, I am actually speaking here, about the biomedical research. It involves human population, so I just want to give you the brief description of the population, which you should have in mind through entire presentation. So our target, where we want to extrapolate our evidence, whatever, or the findings, whatever we are testing, based on the research process or study we are conducting, is a target population. So in terms of the stress training and prevention of osteoporosis in postmenopausal women, our target population will be the postmenopausal women of all the countries in the world, of all ethnic origin, race, but they must be women and postmenopausal because this is our target population. Unfortunately, as we said, when we are collecting the data, this is constrained by the resources what we have, time, and other practical considerations. One of the practical considerations, time and resources, is we cannot select from the entire world postmenopausal women. So therefore, we need source population. Source population should be representative of the target population, hopefully, and here we always use assumptions. And usually source population, if it's a single country study, will be, and if we are conducting it in Georgia, will be the postmenopausal women, postmenopausal women of Georgia. Or if we're doing the multi-country study, for instance, it can be the postmenopausal women of Georgia, Bulgaria, Tajikistan, and Vietnam, if we are doing the studies in those countries. And then we have study population sample. We can use that interchangeably, or sometimes it's even divided more, but here I would suggest that we use this interchangeably. And these are the actual postmenopausal women who will be selected and enrolled in our study to answer this particular question of influence of stress exercise on the osteoporosis in that particular age. Okay. Questions to be considered when we are selecting the population or trying to collect the data to test the hypothesis we created. Who is eligible? So if we are doing the study of osteoporosis in women, men are not eligible. How the exposure is defined? We need to define what we consider the stress exercise or resistance exercise. Is it just an exercise once a month, 3 times a week, every day? What type of exercise? Under supervision, without supervision, at least once a month exercise? How many hours of duration? So in order to establish actual association or to assess this relationship, we really clearly need to define the exposure. Here we perhaps can use ChatGPT or other AI tools and ask how to define exposure in that particular case and what are the common ways of defining the exposure. Then we need to define the outcome, osteoporosis, right? We need to define here how we're gonna, what is it, and commonly we use the well-established definition of the disease in that case. And then we need to measure both outcome and exposure. And how do we measure osteoporosis? Do we do the densitography? Do we do the radiological assessment? How it's done, we need to specify that in the study. And what other variables should also be measured? And those who have a medical education know that usually other variables which should be measured are the potential risk factors or well-established risk factors for that particular outcome. In that case can be like calcium or dairy product intake, or this is one example of that. I wanted to touch the validity of the study, internal validity, external validity, but maybe we can do that later when we speak more about the study designs. So now I want to draw your attention to the study designs. So we have observational versus experimental study designs, cross-sectional versus longitudinal, prospective versus retrospective, ecological versus individual level studies. So I want to ask the audience, what can be the difference between it's very easy, just to have your engagement between observational versus experimental.
Intervention. We need intervention.
Yeah. Do we have intervention in observational studies?
We just observe in observational studies, but in experimental we have intervention.
Yeah. Okay. Do everybody agree on that, that in observational studies we don't have any intervention?
It's in experimental study, you already have prepared design what you try to, right?
which experiments should be done, but observation with just observers.
Yeah, and there might be ongoing kind of intervention, right? Which you not randomly assign or you are not controlling, you just observe. What is the difference between cross-sectional and longitudinal studies?
Cross-sectional studies has limited time. From here to here, 3 months, 6 months.
You're assessing exposure and outcome at the one point of time.
One point of time. What do you do? Yeah, it has time limitations. Time limit. It's not the limitation actually. It can be like, yeah, advantage in some sense that you can do assessment both in one point of time. And what about longitudinal studies? You do the multiple assessments, baseline, and you do the follow-up assessments. Prospective, retrospective is that you look back, for example, you do the record review, and this is a retrospective, and prospective, you just select the group and follow up the group in the future. Ecological versus, sorry?
In retrospective study, you are using all the documents what's already done, for example, some kind of meanings, laboratory data, instrumental data, and
medical record review, absolutely. Yes, yes. And ecological versus individual level studies. Ecological studies are mainly when you're comparing two populations based on the indicators.
Some regions, for example.
Oh, you can, yeah, regions, countries, like,
yeah,
mortality rate in Rustavi, mortality rate in Achar, or Batumi, hopefully they are not too different, and both of them are quite low. But yeah, our life expectancy in Georgia, life expectancy in Armenia. This is kind of ecological study, and the individual level studies are when you collect the information per individual, like, for instance, how long, how old is Federico, and how long he has lived if you follow up me, she has lived if you follow up me throughout my life or whatever. So you identified observational versus experimental studies pretty well. In observational studies, there still might be an intervention, but you are not assigning this intervention randomly. You are just observing this intervention, and in experimental studies, you control the environment, you do the random assessment of the intervention. Cohort studies or experimental studies are basically known to the biomedical research. These are the clinical trials, and clinical trials can be drug trials, surgical trials, behavioral trials. And in observational studies, we can go into more details, and I will speak first the cohort study. First, we need to define the cohort. Cohort is a group of individuals sharing a common characteristic or exposure. Can somebody give me an example of a cohort, for instance? Whatever comes into your mind.
Baby, for example.
What?
Baby till 2 years. Or
so all the children from 0 to 2 years. That can be the definition of the cohort, or in child world, or in Georgia, or in Tbilisi. That's a common characteristic. Age in this case, and location where they live, like place of residence. The cohort can have an exposure or could be without exposure, depending how do we want to organize the study. And then this cohort is tracked over the period of time in case of prospective cohort study, and we are looking for the outcome of our interest. Main thing in the cohort study at baseline, at the time of enrollment, the population should be at risk of particular outcome. So the population should be free of that particular health condition, but should be able to develop this condition. Again, if you are studying the women and you want to assess the risk of osteoporosis, when you design the cohort study, you can design this cohort study and include like start the observation from the age of 18, but you definitely need to choose women and not include men because they should be at risk, at least capable of developing this condition. And another thing what you should keep in mind is that during the cohort study, you never enroll the patients who already have the condition, whatever you are studying. They must be free, and you should follow up in the future to see the development of that condition. So this is just reiteration what I talked about. The cohort studies can be the prospective and retrospective, but main thing in the cohort studies that you have a study population free of disease at the beginning. You have exposed group, unexposed group, which you don't necessarily classify from the beginning. You can observe or measure the exposure and exposure on the way at the baseline. And then you have an exposed group, event group, who developed that particular health outcome, and no event group. And within the unexposed group, you also have event group and no event group. And what is your hypothesis? Are those two groups different from each other with regard to the outcome of interest? And how do you measure that? You measure the frequencies of outcome in exposed group and in unexposed group, right? And compare the frequencies, and then you have statistical tests which can tell you whether this difference is statistically significant or not. So what are the advantages of the cohort study? Can assess multiple outcomes associated with multiple exposure, right? So as I said, our study theme was the women postmenopausal condition, risk of osteoporosis, but in women you can assess other outcomes as well. For instance, cervical cancer, that's what you can also observe, and risk factors for the cervical cancer, or breast cancer, right? You can have a multiple outcomes. Allows evaluation of changes in exposure and outcome over time. So if you do the cohort study and you want to assess the stress exercise influence on the osteoporosis, or effect on the osteoporosis, you have a capability, if you're monitoring those women during the 10-year period, you are doing the monitoring of the exposure, the stress exercise itself, and you are measuring the stress exercise at different points of time. So you have a possibility to monitor, do they increase the exercise in frequency, in duration, change the type of exercise, and then it accounts for these changes during the analysis. Suitable for studying rarer exposures. So if you're studying the rarer exposures, then you need to classify in that case the cohorts exposed versus unexposed, measures the incidence, so-called risk, and medical doctors very much like to identify the risk of disease and talk with patients or among each other. What is the risk of developing disease? What is the survival risk? What are the factors that increase or decrease the risk? Can infer causality. Causality is one who works in this field of epidemiology and biomedical research or any science. It's one thing to establish association, another thing to establish the causality. I don't go deep into the discussion, but causality and association are quite different. In causality, you actually have a causal relationship between the determinant and the outcome. In association, two variables can be associated due to another factor which influences both variables, and there is no causal pathway. And retrospective cohort study, so-called case review, so-called medical record review, can be efficient, cost-effective, quick to perform. What are the disadvantages of a cohort study? As I said, I quite often mention 10 years of follow-up. So disadvantages was to follow-up, compared with the cross-sectional study when you do the one-time assessment. Confounding variables, like when you are assessing risk of exercise or the osteoporosis, there are many confounding variables or potential risk factors that could be associated with the exposure, which is the exercise and outcome. For instance, those who exercise might have a good diet as well because they care about their health. If they care about their health, both diet and exercise can influence the outcome of osteoporosis. So you need to control for the confounders. In a prospective study, it's expensive to conduct. It's very difficult to conduct the research and do the 10-year, 20-year follow-up. You might even need to change the generation of researchers. It's a time-consuming. Those who initiated the research might even not live to the end of the research. And in retrospective study, it has a potential of information bias and recall bias and limited control over population and exposure variables when you do the chart review. For instance, you don't know how the history was collected about this particular disease. So this is a prospective cohort study. We already defined what is target population, what is the source population. Now we know study population, sample. So here this is a sample which is free of outcome. That's the main thing here. It should be free of outcome of interest at the beginning, but can be exposed and unexposed. You're measuring both at baseline and excluding those who already have the outcome. Then you're following them forward in time, and then you have this famous 2x2 table. I don't know, perhaps this table is used in other scientific, in other sciences as well. And then you divide those with exposed, unexposed, diseased, not diseased, or who developed the outcome, and then you compare the frequencies into two groups. So that's what I just said. It reiterates the same. Assemble the cohort, measure baseline information, follow them throughout time, then measure the incidence, which is those who didn't have the disease and developed the disease, in number of cases in a specified period of time. So considering what I thought, I would appreciate if you give me a couple of examples of the cohort studies. From your experience, I would appreciate if NCDC group can participate in that. What kind of cohort studies have you participated or conducted yourself? Yes. Should we give the...
For example, we can use, so I'm Tata from NCDC. So for example, we can use cohort studies during any outbreak investigation. For example, foodborne outbreaks, when we have school children in this, or any infectious disease outbreak in the school. So the people in the school could be considered as a cohort, or a foodborne outbreak in kindergartens. So the students of the kindergarten who were having the gastrointestinal symptoms could be also considered as a cohort, but not only the one. Like the people attending that event could be considered as a cohort, and then we can make this outbreak investigation as a cohort study and do the additional steps that are required in the study.
Okay, so Tada, definitely those with outbreak, those with the disease can be considered as a cohort, but as we said, the cohort study at the beginning, if we do the prospective cohort study, the population, the cohort itself should be free of disease, right? Shouldn't have an outbreak. So in outbreak investigation mostly, and we talked about that, you guys use, but you mostly use the case control studies. For the cohort study designs, you should have people who are free of disease at the beginning, right? So in outbreak, you already have diseased people. The cohort with an outbreak, compared to the cohort without an outbreak, right? Outcome of interest is outbreak.
Yeah.
So in that case, it's a diseased group versus control group. So
no, that would be a case control.
Case control
but
study.
In the outbreaks, you not always use case control. You can use a cohort study when you have defined a cohort. Like you don't need case
and
control.
what do you do? What is your research question in that case? For instance, if you are doing the outbreak in the kindergarten, for instance, foodborne outbreak in an kindergarten, and you define the cohort who has the food poisoning, right? In that particular time. What is your research question then? What you are examining in the future? Survival rates or cure rates from the foodborne infection?
Mostly in the foodborne outbreak, we just want to find out the source. So in that
if
case,
you want to find out the source, then you need to go retrospective and ask about exposure.
Yeah.
So you're going back to the case control design. But if you use a cohort study, you choose those who have the who actually already have the food poisoning, and you can do the follow-up. How many of them survive? This food poisoning, hopefully it's not deadly, but how many of them will be cured in 1 day, in 2 days, in 3 days? I completely agree with you that in outbreaks, by disease, by characteristic, you can define the cohort, but depending on your research question, you either conduct case control study, which explores, and we will talk about that. I appreciate your participation. We will talk about that, about the exposure, or you can look for the survival rates. If it's a serious, for instance, disease, whatever, then you can look at the survival rates. For instance, if you have Crimean Congo fever outbreak, you choose this cohort and just observe how many of them will survive. And that's also the way of conducting the cohort studies. Do you have another example in mind from your profession, like One Health approach of conducting the cohort study? Or any others? Yes, Ima. Thank you. Do you agree with me with the discussion what we just had? Yeah.
During COVID, we had an hypothesis that due to the restriction policy that has been implemented in many other countries, we hypothesized that drug use would shift into risky drug use, which means because of shortage, what is available would be used by those who are people who use drugs, and therefore they would shift into more risky drug use. So we followed up for almost 6 months the cohort of 50 who are people who use drugs with different demographic characteristics and different drug use, so that identify through the biological assessments what is the drug use pattern, and if it changes over time, what is the behavior pattern, and again look for the changes, so it's risky behavior, and that was the 6-month follow-up cohort study.
Thank you very much. And when you identified the cohort, they were definitely drug users, yes, but they have not yet experienced the risky behavior. So they were.
So exposure is the measure.
Yeah.
Restrictive measure introduced by the government because of the policy of kind of quarantine and many other measures related with COVID. So that was the exposure. We hypothesized that it will influence all people who use drugs on their behavior in terms of different drug use and risky behavior.
Thank you. Any other examples of the cohort study? Yes, please, Marina.
I would bring for non-communicable diseases example.
Yes.
When this screened population for cervical cancer, for example, and finding out the disease outcome of the next development of the cervical cancer along the screen.
Yeah, great. So main take-home message, what I want from this part of the presentation is that when we are doing the cohort study, at baseline, those who are in the cohort should not have the disease of particular interest in place if we are assessing that particular disease. But if we are assessing, for instance, neurological outcomes, and this patient has a broken leg, which is fine. People with broken leg can still develop neurological outcome, but should not have that particular disease of interest. And then we are measuring both exposure and outcome.
Sorry.
Yes.
Excuse me. Again, so this excludes the outbreak investigation settings.
Yes. If you are
in outbreak investigation settings,
you could use the cohort design, but inherently it's not a cohort.
Yeah, you can use, but then you need to start from exposure.
Yeah.
You need to start from the entire child. You should not define the children by the presence of outbreak.
Yes. So for the outbreak also.
Yeah.
For the outbreak investigation, for example, or at like a wedding, for example. You have a wedding and people got some intestinal symptoms afterwards, food poisoning, and your cohort would be the people who attended this wedding.
Yes.
So it's all those people.
Yeah, people who attended the wedding,
yes,
not who experienced the
yeah, of course. So that's the cohort.
Yes.
And after that, you just go with the interviews, you see who ate what. And your research question is just to find out what was the source that caused the outbreak.
What kind of cohort study is that? Retrospective or prospective?
That would be a retrospective.
Retrospective cohort study, when your population is embedded. Absolutely right. If you start the organizing with the exposure, definitely you can use the cohort study. Your father would definitely choose case control though. But anyways.
They are debated.
Yes, it's debatable.
I think in the wedding settings or in a closed dinner parties or something like that, cohort studies are much easier to perform. That's why you go with the cohort studies, and then with the risk ratio, odds ratio, you choose the one that will bring your study. And
Sure, dear. Absolutely. If you start with the entire population, entire exposed population, irrespective of outcome or irrespective of exposure, just defining by the place, like or event, then you definitely can use the cohort study. Yes, thank you so much. Then we have the examples of the very well-known cohort studies, which is the Framingham Heart study, started in 1948. Not sure if the researcher who initiated this study was alive by the end of this study. It included the several populations, 3 generations of initial population. It studied the multiple outcomes and multiple exposures. Then we have 3 HIV cohort, and here we define by main exposure, HIV, and we wanted to know within the HIV population particular health outcomes over time, and they follow, not we, they follow, Swiss follows those people with HIV throughout how many years, I don't know, and it's not written here, but quite a while, and it resulted, and there is a link, and the presentation will be shared with you all, and there have been 542 publications. Now let's go to the case control studies. This is another design. This is for rare diseases, and you will need to recruit a large number. If we do the cohort study for rare diseases, just to catch at least one event, then you need a lot of individuals to be enrolled, free of disease. Like if the risk of disease development, for instance, is 1 case per 100,000, just to catch one case, you need to follow up 100,000 people. Who has that much money, right? Nobody. So therefore, the researchers thought of another design, which is a case control study design, where you choose the cases and then choose the controls for those cases and assess retrospectively. So, the case control studies allows for the rare diseases that could be empirical to study through other methods, impractical to study, through other methods, and I'm giving the same example. So a disease with 1 in 1 million incidents per year. So if we have, and I must be aware of time, please tell me if I'm too performing here too much. So in a case control study, what we do, we use it for rare diseases, we choose cases and controls. Case control study has one outcome, one disease of our interest, whatever we want to study, but it can have a multiple exposure. So this is an advantage of case control study. Then other advantages, it can be used during the disease outbreaks, and also because it's a rare disease, and for the statistical analysis you need the statistical power, then you can choose one case per 2 control, or 1 case per 4 control. Provides rapid, low-cost information, can be useful for generation of the hypothesis, and you can calculate the odds ratio. Disadvantages, it can lead for the false association, because you are recalling the exposure when you are doing the case control study, and you are asking those diseased versus those healthy about the presence or absence of exposure, and those who are diseased, they mostly recall the exposure whether it was present or not, and those who are not diseased might not recall, might haven't paid the attention to the exposure. One of the limitations of case control study is that it cannot measure incidence or prevalence, but it can definitely measure the odds of exposure among disease. Challenges in selecting appropriate control groups. Cases and controls should have similar characteristics like age, gender, health status, other, because this way you kind of control the confounding, potential confounders when comparing the exposure, when assessing or measuring the exposure effect to the outcome. They should be from the same environment, because environmental factors can be also the potential confounders. And here, what is the design here? The past or present doesn't matter, but you definitely, in the present, you should have those with the disease and without the disease, so cases and controls, and you are retrospectively assessing the exposure of interest, the multiple exposures of interest among cases and among controls. Since we have a little time, I will just move quickly. Then we have cross-sectional study design, which is a snapshot, measures both the disease and the exposure at one time. You just go one time to a person and ask, do you have osteoporosis? Or you measure the osteoporosis one time, and in the same day, in that particular visit, you ask, have you done the stress exercise 3 times per week in like this week or past 10 years? But you have one visit from one participant where you measure both outcome of interest and exposure. Prevalence studies, usually cross-sectional studies are called prevalence studies because you cannot actually differentiate between them. Between the new event, whether this is osteoporosis just developed this year or it has been developed like 10 years ago, what can assess during the case cross-sectional studies is the burden of the disease, actual prevalence of the disease in the population. What are the advantages of the cross-sectional studies? It's relatively quick. If you have 1,000 people, of course, you cannot examine them in one day, but you can examine 10 people one day, right? So you can finish it pretty quickly with just one-time contact. It's inexpensive to conduct, considering sitting there and doing the multiple assessments over the 10-year period. No loss to follow up, whoever you enroll. Multiple outcomes and exposures can be measured. When you are asking about the osteoporosis, you can also ask about the tuberculosis. It's a weird comparison, but I have tuberculosis always in mind. Good first step before cohort or experimental study can be designed. Disadvantages. Impractical for rare diseases. For instance, if you are trying to assess what's the rare disease, I don't know, pheochromocytoma, and you want to assess the burden of pheochromocytoma, your cross-sectional study will be quite long. You will almost have to do the census of screening of entire population just to find the pheochromocytoma. I don't know if I'm pronouncing this right. Unable to investigate the temporal relationship, that's clear, because the person comes to you already either has a disease or doesn't have a disease, but you don't know whether exposure was first or disease was first. Person might report that, oh, I started exercise like 10 years ago, but if this person is already 60, osteoporosis might have been present 10 years ago as well. So you cannot still establish the temporality. Hard to establish the causal relationship if you cannot establish the temporality. Right away there, you cannot establish the causal relationship that exposure caused the outcome, and incidence cannot be measured because you cannot differentiate between the new case versus case that already existed. Examples of cross-sectional study. Any census that the National Center of Disease Control does, or that Statistics Department does, is the cross-sectional study. Political polls are the cross-sectional studies when they ask about the political opinions. What? Majority of dissertations, unfortunately, are cross-sectional study, and they should not be. Neither should be the literature reviews. Applications of cross-sectional study. You assess the burden of that particular health condition. So you are planning the preventive health services based on the burden. Administering the health care, for instance, depending on the burden, developing the surveillance programs and conducting surveys and polls. Now, a few words about qualitative and quantitative research. That was part of the topic, but I am not a qualitative researcher. We have Irma, who is, but others perhaps are as well. I think Marina is also does the qualitative research. I just want to highlight the differences, what's the focus of qualitative and quantitative research. In quantitative research, we are testing hypotheses. Qualitative research exploring ideas, formulating hypotheses and theories. Therefore, it's very popular nowadays to do the mixed method research analysis, summarizing, categorizing, interpreting. Here in quantitative part, we are doing the math and statistical analysis expressed in words. In qualitative research, interviews, focus group interviews, individual structured interviews. In quantitative research, we recode the words, even no words, just the data. So we are recoding everything. A sample, fewer representatives, interviewed 10 people, spend the time, had a good structured interview, can publish. You can rarely publish in quantitative research with the 10 people, sample of 10 people, unless you're doing the case series, which is kind of a mixture of qualitative and quantitative. And then we have questions, open-ended in qualitative, close-ended, because we want to be as structured as possible in quantitative research. Qualitative research understands context, complexity, subjectivity. It's all about how you perceive things. And in quantitative research, testing, measuring objectivity and replicability. And that's right? I have 5 minutes still? Okay. Quantitative data collection methods, surveys, experiment, observations. We already talked about that. Qualitative data collection methods, interviews, focus groups, ethnography, literature review. Literature reviews can be used in quantitative data analysis, but it's a part of it, just the literature review is never quantitative research. Thank you.
Thank you, Verika, so much. That was very interesting. It was really basic for research, and not only basics, because you provided something more to the basics. But what else I would like to add? So within the project of education for better employment, we have developed short training courses which will be available for those who need to go deeper in research methods and different kinds of components, including the design, including questionnaire development, including literature review. And so we are really open to register people who really want to have these courses, and I kindly ask you to share this information to people who could be interested in it. Now, if any of you have quick questions, because we need to move quickly to our practical part of the session with Avi.
Always it's very interesting how many times we study it, but it's always problematic how to choose relevant research methods. But all these methods about population study, right? What you heard about ecology fallacy, what is very actual last years, and do you have information about this kind of investigation or research in Georgia? I never heard about. Okay, thank you.
For the question. I don't know ecological fallacy about the last year. Probably there is one, but the well-known kind of scientific fallacy is that death rate, like mortality rates in Sweden compared to mortality rates, and I'm making this up because I don't remember the countries in Zimbabwe, right? It's well known in Zimbabwe, for instance, health systems are pretty poor, but mortality rates can be lower compared to the mortality rates in Switzerland, not Sweden, Switzerland, because there's an older population in Switzerland and younger population in Zimbabwe. All is made up, please keep in mind, I'm just giving the example. But because we are doing the ecological study and just comparing the population, not individuals, not adjusting for age, just talking about the countries, we have this fallacy because we think, wow, in Switzerland, the healthcare system is good, food is good, life is safe, so why more people are dying compared to the other country X, where everything is poor. This is ecological policy because fallacy, I'm not pronouncing it right, whatever. Yeah, because you're measuring that particular outcome, whatever indicator based on just the country and not accounting for other potential influential factors.
I think it would be very good to go to the personalized medicine, how to think about individual.
It has different purposes. Like if you have, it's not that you should choose one over another, I think. It just has different purposes. It's always good to see the country profiles of different countries with regard to different diseases, expectancies, birth rates, but that can serve as a basis for the future individual-based research.
Thank you, Veriko. Thank you, Elsa. Now, Avi, floor is yours. So now we have 30 minutes of work with AI tools for research design and research processes. And we will have coffee break at 11:45 for 15 minutes.
Okay, good morning everybody, and welcome back. For those who have powered through for the third day, I hope that you'll be rewarded because today we're going to learn a lot of practical techniques. So as opposed to talking about, we're going to look at and actually practice different tools that are going to help us to accomplish different tasks across the entire research life cycle. So I really hope that you come out today with a few techniques for how you can go about actually doing the research. And let's keep in mind that one of the rules that we talked about on day one, for those who are here, was we want to use AI when there's two requirements. Okay, number one is that we can oversee the answers and determine whether those answers are good or bad. So for example, we're going to see in a minute how we might want to use GPT to help us decide on a research question, what methods might be possible. But if I'm a first-year student, right, or if you're teaching first-year students, you might want to give them guidance that they shouldn't just copy-paste. If they ask for a research method and they say, okay, well, GPT told me this is the research method, the esteemed professors here can say, yeah, good idea, bad idea. Our students might not necessarily be able to do that. So that's number one. Keep in mind who it is that's, the ability to oversee and check whether it's right or wrong. The second rule that we learned that we're going to put into practice now is the question of variance. So we talked about when I need a very specific answer to a question, and there is no room for error, right? 1 + 1 has to equal 2. We do not want to be using large language models, okay? Because they have a tendency to make mistakes. However, when variance is a benefit, when getting different answers to the same question or different ideas is a benefit, then GPT and other large language models can be very beneficial. So for example, if we're trying to come up with 5 different ways five different methods to answer a research question, and again, assuming that we can oversee those methods and decide yes, good idea, or no, bad idea, that can be very helpful to us. Okay, the fact that it's creative, okay, so to speak, is a big benefit. Okay, so let's actually go ahead and do this, and maybe what we can do is, to make it a little bit more fun and interactive, you can kind of do it along with me. Okay, so everyone can open up their laptops. Okay, and the first thing we're going to want to do is just think about a research question that we want to be attacking today. With your permission, I'm going to steal your research question just so that there's a continuity to the conversation. But everyone, when you're working on your own computers, think about your own research question, okay? You don't need to have a perfect research question to do this activity. In fact, we're going to improve the research question, help it using GPT for help. Okay, so I'm going to start off with, so first of all, as we've discussed before, whenever we're working with GPT, it's good to use the chain of thought prompting method, which essentially means that we know what we're going to do. We're talking about it. We've been talking about it for the last few days. GPT doesn't know anything, okay? It's the dumb first-year student who doesn't know anything yet, so we need to introduce. We are going to work together step by step in order to create a research topic and design. Can you help me? Okay, so take by step. And it's giving me some intro questions. All right, and I'm going to throw in the question that we had before. I want to look at weather resistance training. Okay, so let me show you how I built this prompt. Okay, nothing fancy here. First, I just kind of gave it in my own words. I didn't even phrase it as a research question per se. I just said, I'm looking to study whether resistance training reduces osteoporosis risk in postmenopausal women. And then what I'm giving it the task. First, I'd like you to help me formulate a research question, but I say, give me 7 ideas, okay? If I don't say give me 7 ideas, it might give me 1 idea, and then I might say yes, no. But actually, I want variety here, right? I want it to be creative. You know what? I'm going to even make it stricter. Give me 7 ideas, and justify your answers. Okay? We're not getting to sources just yet. We'll get to sources, and we'll see how that works. Okay? But for now, we're going to want to look at what it can do. So again, you can work alongside with me. Let's look at some of these possibilities. How does resistance training impact bone mineral density in postmenopausal women? What is the effect of different intensities of resistance training? Does long-term resistance training reduce fracture risk? How does resistance training compare to other forms of exercise? What are the effects of resistance training on bone metabolism? So it's actually digging in and giving me more specific questions, which, listen to our conversation here, right? Right, so this is good because it's kind of drilling down a little bit. Now what it's not doing, it's important to say what it's not doing. It is not looking at the literature right now and saying, this is an unanswered question. Okay, so this doesn't answer novelty. That's important to point out. It could be that some of these questions have been asked and studied 15 times, and some of them may never have been addressed. Okay, we're not there. For now, we're assuming, someone's doing a literature review. We'll next session, I think, is literature review, so we'll go through some of the tools, AI tools to do that. But for now, I'm just getting creative, okay? And let's say I say, you know what, I am curious, I'm always looking at this question, about different forms of exercise, okay? So let's say I say, out of these 7 suggestions, I really like the question of how does resistance training compare to other forms of exercise in reducing osteoporosis risk? Okay, so I like the following question, formulation. Now obviously, if I decide, you know what, I don't like any of these exactly, but maybe it gave me an idea for what I want to do, I can say, well, actually, I want to be pursuing a different question. The next thing that I'll do here is I'll say, how can we improve this research question and add a few sub-questions, right, that we will need to answer in order to answer our main research question. And again, here too, I might want to, right, depending on how much time and patience I have, I might want to say, give me 10, give me 20, right? I can be, but for now I'm just going to ask it to do it, so let's see what it gives me. Okay, thank you so much. It's a strong research question. I'm so happy that you think so. Now let's see. Okay, so let's look at the refined research question. What is the comparative effect of resistance training versus other forms of exercise, for example, aerobic and weight bearing, on osteoporosis risk factors in postmenopausal women? Sounds like a solid research question to me. I think it would have, as a student, this would have taken me a long time to understand. Now, what's important is when you're teaching, I would actually do this as a second step, right? First, force the students to try and formulate it themselves so that they're understanding what the components of a good research question are, but then show them that this can be used in a really beneficial way. So now it's suggesting some sub-questions. How does resistance training affect bone mineral density, BMD, in women compared to aerobic and weight-bearing exercises? Okay, what are the effects of resistance training, aerobic exercise and weight-bearing exercise on bone turnover markers? Okay, and for some reason it gave me an error. Let me try again. Excuse me. Oh. Sorry?
Is it free of charge version or?
I have not logged in, so this is free of charge. Okay.
Sorry,
Yes, please.
Can you ask using some guidelines from the first prompt? For example, Peacock guidelines are very popular formulating questions. Not.
That's a great idea. Yeah, I would highly.
I do like usually do use some of these guidelines to formulate.
100%. So if you've got certain guidelines that you need to be following when putting together your research question, or maybe certain ethical guidelines, right? You could ask really interesting questions, but maybe it wouldn't pass, the Helsinki, standards. So what I would suggest here, if you can, is go ahead and upload, okay? Download whatever guidelines it is that you're looking to accomplish, upload them here and say, I actually want you to now, you could do it from the outset, you could do it from the first prompt, or you could do it now and say, please make sure that these research questions are in line with the following guidelines. Yeah, that'll do a pretty good job of that. Yeah?
Yes, the same would be if we ask, give us some published research results to use this method.
So I would not do that. I would not do that. Because again, GPT, and I'll remind everybody what we talked about on the first day. For now, and GPT is changing slowly but surely, but for now, GPT, again, what it does in order to give us these answers, it is learning from all of the materials online, but again, it makes a big salad out of it. So it no longer, it can't tell me, I got this research question from this paper. What it can tell me is, sorry. So I wouldn't suggest doing that because it mixes all the sources together in order to give me the output. So there's no, right, we don't see any citations here, right? That's because it is not picking from one source, it is picking from millions of sources, right? But it's mixing them all together. We'll see shortly. First of all, I remind you, we looked at perplexity. That would be a better task for perplexity that we saw, the deep research function that we saw on the first day. I'm going to show you one or two other tools at the end of the next session when you want to look at what's already there. So for now, I kind of bounce back and forth between ChatGPT, again, for the creative side, and then the other literature review tools for actually searching what's been done. Okay? You can try and ask it. I really don't trust the answers that I get from GPT. Okay, so now, all right, I'm going to say this looks great. I'm hoping that everybody's kind of, following along, but doing it with your own topic, so that it actually is most beneficial to you, or maybe a topic that you've always wanted to research, but you don't have time. Okay, now's your opportunity to kind of work on it a little bit in real time. Now I want to say this looks great. would be, let's ask for 5 research, or 5 of the most, reasonable hypotheses for this question. Now, again, from a pedagogical standpoint, you might want to ask yourself, maybe I want to be the one who's coming up with the hypothesis, right? I don't necessarily want. But what I think you can do is you can come up with a hypothesis yourself, and then you can also feed that into GPT and say, okay, my hypothesis is going to be X, Y, Z. Challenge that, right, that thinking, right, before I go in. But for now, I'm going to ask it for 5 ideas. Okay, so the BMD hypothesis is that resistance training will lead to greater improvements in BMD compared to aerobic exercise, but have similar effects to weight-bearing exercise. I don't know. I'll ask the experts here whether that seems to be a reasonable hypothesis or not. Second hypothesis is around bone metabolism. Resistance training and weight-bearing exercise will result in greater increases in bone formation markers and greater reductions in bone resorption markers compared to aerobic exercise. There's a hypothesis here around fractures and fall risk. Anyway, I think you get the point. You can see here that I can actually shoot, right? I can actually think through. Again, my suggestion here would be to actually put in your own hypothesis and then ask it to, you know what, so let's do that right now. So let's take, I like hypothesis 1 about BMD and leading to improvements in, resistance training leading to improvements in BMD. But I now want you to play the role of reviewer 2 and tell me why this hypothesis isn't good. Okay? And so now I'm asking it to kind of poke holes in the hypothesis. Okay? And here are some of the considerations that I might be overlooking, okay, in this hypothesis before, and again, we haven't even gotten to designing the research study, but it's important, right? Half the job of doing a good study is actually coming up with a very well-defined question that we're checking the right parameters in order to accomplish. So let's see. So it's reviewer 2's critique, right? Reviewer 2 is the reviewer who's always giving us a hard time. So maybe it's an oversimplification of exercise effects. So the hypothesis assumes that resistance training and weight-bearing exercise will have similar effects on BMD, but not all weight-bearing exercises are equal. High-impact activities such as jumping, plyometrics may have greater osteogenic effects than low-impact weight-bearing exercise, for example, walking. Right? So, and this is already, I'm starting to think in my mind, okay, I need to be very specific about what am I studying, right? Can I throw everybody into the same category? It's interesting, this as an example, because my wife was studying postpartum women for her master's thesis, and she was looking at exercise and the impact of exercise and movement postpartum. And we had a lot of conversations because she looked at people who did dance and people who did yoga, and those were kind of the most common, at least right where I am in my neighborhood, that's the most common exercise. And then the question was, well, yoga is a very different exercise than dance, right? So can you actually put them together, or should we be comparing and contrasting the different exercise forms? Anyway, I'm just saying that as in parentheses because it's very interesting, because I see that similar themes here about exercise is not one activity. There's a lot of different things you can do. Someone who runs marathons is very different than someone who does yoga. They're both good, but could be in very different ways. Anyway, okay, so you see here that kind of approach. And it also, it went beyond what I asked it to do, and it gave me suggestions for an improved hypothesis. So now it's suggesting resistance training at moderate to high intensity will result in greater improvements in BMD. So it actually added in this high-intensity training, right? Not someone who just does low-intensity training, compared to aerobic exercise and low-impact weight-bearing exercise in post-menopausal women over a 12-month period. Okay, and it explains that it added more specificity to the prompt, to the hypothesis, clarified the comparison, and it better aligns with the existing evidence. Okay, I don't know if it actually knows the existing evidence. Okay, again, here's where you come in and say, yes, that makes sense. No, that doesn't make sense, and make a decision.
So when it says it aligns with the evidence, we shouldn't trust that.
I don't trust it. Now, again, it may be true. I'm not saying that it's for sure not true. It's just not for sure true. So again, it's giving me words. So it could be that it has properly identified in its own memory the content, whether that's academic or blogs or medical sites, and it's understood it properly, and now it's giving me. It is possible. It's just not, I have no way of checking it. It's not transparent. So I just don't trust it. That's the point, okay? So you have to use your best judgment. I don't know why it gave me an angry emoji at the end of this. Okay, that's interesting. All right, maybe it doesn't like where I'm going with this. Okay, all right. What now? And I'm really just kind of going off of your presentation, right? The next thing we need to do is choose a population. Now, can you help me define a population for this study? I'm located in Tbilisi. Okay, so it's giving me a population definition, and again, this isn't to be copied and pasted, so again, careful with the first year students, we're just going to be like, okay, this sounds good, right? This is to be critically analyzed, right? I actually think that in certain ways, it turns us into reviewers or managers of research, right? Which we have to think about, is that what we want to do or not? Okay, but what I actually really like is not so much that it gives me the initial idea, but I have an idea, then I throw it in and I say, ooh, let's see how it compares and contrasts to the idea that I had about how to structure it. The other thing I'd like to say is, there's so much that goes into preparing a study and a study design that it helps me just when I forget, oh yeah, I need to relate to, for example, exactly how long it's been since people have been in, let's say I want to do a comparative study and I've got a group that does do, weight training and doesn't do weight training. Well, again, going back to my wife's research, the question was, right, obviously they haven't been doing weight training or they haven't been doing exercise recently, they just had a baby. So how far back do I go, right, in terms of, right, little questions like that where I may not think about it at first glance, but actually using GPT reminds me, oh, I need to actually address this question, otherwise it's going to be incomplete. So here it's suggesting inclusion criteria of women from 50 to 70, have been post-menopause for at least a year. They live in Tbilisi, so it makes it easier for us to do the study. They're not currently engaged in weight-bearing or aerobic exercise programs, so that we have a comparison group. And it's giving us some exclusion criteria as well, right? People have already been diagnosed, people are on different medications, etc. Again, I'll leave it to the experts here to decide.
It just gives the population for cohort study, because the study can be done in many different ways.
Okay, so let's push it.
This is just a cohort study design, what it gave. So, how about doing the case control study for the study population for the case control studies? So
here's what I want to do. So I was about to get to that. This is great for a cohort study, but I'm not sure that's what I want to use. Can you suggest 5 different study designs? Sorry? 5 is too much. Okay, so let's do 3. 3 different study designs, including the benefits and downfalls of each approach for our specific topic.
Now we will definitely have anchor emoji.
Let's see. Okay, so now it's giving me a few different suggestions. It's suggesting a randomized controlled trial. Okay, telling me the benefits, and it's suggesting we assign them to 3 groups: resistance training, aerobic exercise, and weight-bearing exercise. It's giving me the benefits: our strongest causal evidence, direct intervention, longitudinal data. But it also gives me some of the downsides. It's expensive and time-consuming, right? It definitely is listening to us, I would say. Participant compliance, right? Whether people will see it through, and ethical concerns. Cross-sectional study or prospective cohort study. Okay, I can go through and decide, you know, which one based on some of the suggestions, and I can always kind of, what I like to call, pull on the thread. So if I say, okay, let's go with the prospective cohort study, but I want to check the following things, you can go ahead and do that. Okay, so you can it's almost an endless conversation. If you have the free version, it's not endless because eventually they'll say you've used up too much tokens, but there's no limit to follow-up questions in principle that you can ask on a specific topic. So anytime someone says, well, can it do X or Y? So I always say, ask it, right? And see what results you get. Okay, so this is kind of just an example of how you might kind of put into play some of the techniques that we learned about earlier today using AI. And again, this can be done in ChatGPT, this can be done using Claude, this can be done using Copilot. It's not unique, okay, to ChatGPT. It's any of the large language models. And what I want you to think about is what's the process you'd like to follow depending on your experience and your knowledge of the field. So again, if you're setting it up for yourself, maybe you want to come up with an initial, proposal, or you want to come up with an initial research design yourself. And then you're going to you might want to throw it in there and say, give me some critique. What haven't I thought of? What haven't I included in there? Okay? That might be one way to go about it. Another way to go about it might be you say, you know what? I'm going to start with nothing. I'm not going to think through it. I'm going to let GPT give me some ideas. Then I'm going to critique. I'm going to play the role of reviewer. I'm going to say, this is a good idea. This is a bad idea. This is going to work for us. This is not going to work for us. But again, I really encourage you, think about the differences between you when you're using it internally in your office and when you're teaching students. Because if you're teaching students and you give them this option, you might just have them just copy and paste whatever the first suggestion is, right? And that's not what we want to do. So maybe you want to give them an exercise in class and say, have GPT suggest 5 research designs, and then I want you to tell me, right, verbally in class, which one you would choose and why. Okay, that might be an interesting way to kind of make sure that they're understanding, right? And start giving them questions. Okay, how much time do I have? Not so much. 4 minutes, okay. So I will show you a different tool. You might not have a chance to use it now, okay? But I highly encourage it. And this is specifically, anyone here apply for grants from time to time? Great, okay. And a tool that I really, really love, okay? First of all, let me explain how I get to this tool. Okay, the tool is called, well, let's start at the beginning. In ChatGPT, there's regular ChatGPT, and then there are what are called GPTs. I know it's confusing, I didn't make up the words, so don't blame me, okay? And you can explore GPTs, okay? The best way to understand what this is imagine it's like an app on your phone. Imagine ChatGPT is the cell phone, okay? And then the GPTs are apps that go onto the phone that you can add to the phone that help you do specific tasks. So essentially what this tool does is any company or any individual person, we could do this right now, can upload their own data, their own information, and say, instead of you answering the questions that I'm going to ask based on the entire world of content you have, I only want you to answer the questions based on this specific data that I'm giving you. Okay, so let me give you an example. For the first suggestion that they give me here is Expedia. That's a travel website. In theory, I could say, listen, I'm supposed to be traveling back home this evening, but I love Georgia so much I want to stay for 2 more weeks. Can you please find me a flight, right, in 2 weeks' time that's under $400 back home? Okay? I could do that with the Expedia GPT, and then instead of it searching the big memory of all the content in the world, which is useless because that's not very helpful, it'll search Expedia's search algorithm of flights with times and prices. Okay, so it's much more valuable to me than just searching GPT. That's just an example of a GPT. Well, it's incredible. You can search, there's GPTs for almost anything, okay?
Magic.
Well, I don't want to say it's magic, and of course we need to be critical, because sometimes when we think something's magic, we stop thinking critically. You can do this also for their Scholar GPT, one of my favorite. I know people who are building it. It's an awesome tool. There you can find exact sources, okay? Maybe we'll have a look at that. What I want to do right now... Sorry? Okay, so you want me to continue through it. Fine. So then I'll... Fine. Okay, all right. So we'll continue through that. Fundable AI. So what I want to look at right now is called Fundable AI Modern Fundraising. Okay, it's created by a... I know the guy who made it. His name is Christian Zimlich. He's from Slovenia. He is a grant consultant. Okay, so this is not someone who just... This is someone who knows the field. By the way, this is entirely free. So there's no cost to use these tools. It's called Fundable AI Modern Fundraising. Okay, and this is specifically for people who are applying for Horizon grants. Okay, so it's okay if you're not. I want to show you what's possible to do an individual on their own. This is not a big company that spent millions of dollars. This is one individual. Okay, and I want to show you how it works. And then what I want you to do here is I want you to click on Start Chat. Okay? You'll see here that there's a rating for every tool. So if a tool has a very high rating, good sign. If it has a low rating, bad sign. You also see how many people have conversed with this tool. So over 1,000 people have done it. So we're in good company. If it's 20 people have done it, then maybe we don't trust it as much. Okay? So what I want everyone to do, if we have 5 minutes, is I want everyone to go into go into ChatGPT. On the left-hand side, you should have Explore GPTs. Look for Fundable AI, Modern Fundraising. And I want you to just click the button. I'm ready to brainstorm. Okay? Let it guide you. It will guide you to what it wants from you. Okay? You need to come up with a basic, same what we saw before. You need to have a basic idea of what you want to study. Okay? That's the basics that you need. Once you have that, it will guide you on how to make a really solid proposal for Horizon. Okay, so instead of us breaking our heads against the wall, trying to figure out what do they want and how should I write it and how many words, that's all done for us. Okay, very cool tool. Again, go to Explore GPTs and then click, and then Fundable AI with no space between the word Fundable and AI. Now, I will say, Becca, to get through this process properly, it probably takes like half hour, 45 minutes. So what I suggest is people can go in now and just start a conversation. You can always go back and continue it in your free time.
Irma, let's start with your introduction, please. Introduce first yourself, because not everyone may listen to you during the previous days.
Thank you, Eka. All right, I think after coffee, we are a little bit energized and are ready to listen another session. So I'm Irma Kirtadze. I'm a background, I'm a psychiatrist, by the way. But I'm more than 20 years already in the field of drug research. Psychoactive substance use. I'm an associated professor at the Ilia State University for the Addiction Studies program. And I teach also at the medical and natural science faculty, at the business faculty, and the majority of my subjects are related with health program planning, implementation and evaluation, health promotion programs, and plus research methods as well. So today I was asked to prepare for you the presentation on, actually in the style of masterclass, about the scoping review. What is this methodology and for what it has been used, so that we are able to apply, so that we are kind of at least exposed on what is the scoping review and for what it could be used. Before diving deeply into scoping review, I would like to present you this kind of triangle or pyramid, whatever. It works in either way. So we have here the level of evidence that comes from the different studies, which are based on their design of methodology. They are, we call it more sophisticated and more quality in terms of providing the qualitative, the quality of data. So here we have the animal on a bottom line. We have animal and laboratory studies, which doesn't involve the human participants. These studies provide for us some preliminary data so that we can differentiate it in the terms of in case of animals, if it happens in this way, maybe we can assume how it could be the process of, I don't know, metabolitis or anything could work in human beings. So therefore we do some studies that cannot be conducted with the human participants. Then on the fifth level, we have the case reports and case series, and thanks to Verico's excellent introduction of those studies, which we have on the fourth and third and further levels, which are the case control studies and cohort studies. These are the studies that are non-experimental, provide observational data. They are, sometimes we call, for example, cross-sectional studies, we call prevalence studies. So these are the primary study designs we use in healthcare sector. And the highest level, which is actually also highlighted as a first level of evidence, we receive from the RCTs, randomized controlled trials that test some interventions that are experiment-based studies, and based on lots of randomized controlled trials, researchers conduct the meta-analysis, which produce the high credibility and high valuable data for the health sector. And based on this, we have elaborated clinical practice guidelines. So these are kind of, this triangle provides the guidance on what type of study design gives us to what sort of information and what is the quality of the information we get from each of the study designs. I'm sure a lot of you, almost maybe all of you, have experience doing the literature review, because whatever you do, what kind of assignment you've been asked to perform, everything starts from literature review, which involves these kind of 6 major steps. Formulating the research questions and objectives, searching the existing literature, screening for inclusion because we are looking for particular topic, particular theme, then assessing the quality of primary studies, which should be included in your literature review or not, and then extracting data and analyzing data. But I have to tell you that this is the kind of literature review that is broader, and there are lots of types of reviews. And I would ask you, which types of literature reviews are you familiar with? Or which types have you maybe used or at least heard about? Could you just name scoping reviews, narrative reviews, systematic reviews? What else? Any others? Just only 4? other ideas about different types of reviews? Scoping review already has been said. Scoping, then was systematic review, then was critical review, narrative review, rapid review.
I asked AI.
Okay, we don't need AI. We could rely on publication. This publication is Grant and Boots publication, which provide 14 type of reviews. These are critical review, literature review, mapping review, and by the way, I have here the citation, and when you receive the slides, you will be able to extract this publication from internet. All of them are free of charge. So, systematic map, right? Here we have. Then meta-analysis, mixed studies review, which uses the mixed method review, overview, qualitative systematic review, qualitative evidence synthesis. Then we have critical review, literature review, mapping review. It's the same, sorry. Oops. Do we have any questions from Zoom attendees? Okay. Those in Zoom, please mute your mic if you are not asking question. Do you have any questions? Okay. Then continue. The rapid review, scoping review, state-of-the-art review, systematic review, systematic search and review, systematized review, and umbrella review. So this is the publication from 2009. Since that, probably there are some other reviews, types of reviews that could be added on this table, but these two authors provide thorough description and distinguishing what's the difference between those different types of reviews. So again, according to those authors, Grant and Booth, scoping review is preliminary assessment of potential size and scope of available research literature, aims to identify the nature and extent of research evidence. So this is the review that looks exclusively for the nature and extent of research evidence. What are the evidence there on a topic I'm interested in? Completeness of searching determined by time, scope, constraints, and may include research in progress as well. So you are looking for not only completed research, but also those research that are in process, because it depends on your research question that might involve the studies which are in the process of study. So no formal quality assessment is required in scoping review, while in systematic reviews or meta-analysis we read what criteria of quality assessment they have, because they assess each study based on their criteria of inclusion and exclusion. So we do have inclusion and exclusion criteria, but we do not check the quality of the papers, quality of the study that has been conducted for our scoping review. We just check if there is an publication on a particular topic. Typically, it's tabular with some narrative commentary and characterizes quantity and quality of literature. perhaps by study design and other key kind of features, and attempts to specify the variable view.
Shall we say that literature review is the scope review?
A little bit different because in literature review we rely on already published publications. But in scoping review we could include those studies which are not completed yet, but there are some sort of data, yes. Because scoping review tries to understand by itself to map the evidence and identify the knowledge gaps in research. We try to, unlike the systematic reviews, for example, which addresses the specific research questions with a precise methodology, scoping reviews are much broader in their methodology. They aim to provide an overview of the available research evidence, identify key characteristics, and highlight the gaps in the current knowledge what we have today. And therefore this methodology helps understanding kind of emerging evidence and the breadth of information on a new or poorly defined topic rather than the quality and deepness. Because in literature review we have particular topic which will be covered from the already existed evidence. While in scoping review, we are not focusing on what is the evidence. We are focusing on, is there evidence on our particular interest topic or not? Because we are tickling the existence of the gap within the literature. Because we somehow try to identify the future steps, what are needs in terms of following research. Scoping reviews are like research treasure hunts, mapping out the key concepts and evidence in a broad topic area to identify gaps and opportunities for further study. So systematic reviews in healthcare begin to appear in publications in the 1970s, 1980s, while the scoping review, they're relatively new and they appear in publications after 2000 year. So what are the key characteristics of scoping review? Scoping reviews search and synthesize existing literature, but allow for greater flexibility. This process clarifies the working definitions and conceptual boundaries, provides a preliminary assessment of the size and scope of available research literature. The scoping review method can identify the gaps in the research and suggest areas for future research priorities. And this approach is valuable in fields where research is developing or where there is a significant amount of disparity and information to be synthesized. So, when to use the scoping review? Because we use literature review in our studies to write the introduction section, while scoping review is absolutely separate kind of study because it requires a lot of effort, time, it's time consuming, and it cannot be done by one person. So when the ideal? They're ideal when exploring new or complex research areas where the evidence may be sparse or varied. Useful to conduct when the research question is exploratory and not limited to specific interventions or outcomes, providing a comprehensive overview of relevant literature. Tend to be used when the goal is to identify gaps in the research evidence and suggest area for future research. They can inform future research priorities by highlighting area where evidence is lacking. So, question to you. How do you think how we should start doing this scoping review? Any ideas? Shoot ideas. How to start scoping review? Write a keywords, research, formulate research question. More ideas? Find sources. Any others?
If we want to publish, we should find the journals first.
Find journals appropriate. Okay.
Let's say databases, really.
Okay, what databases we need to search?
Do we need to register this type of?
Do we need to register? Okay.
Strobe guideline for scoping.
Strobe guideline, consort guideline, okay. Any other different ideas? Okay, I will not torture you, and I say that we need to identify a team. This is the first step, to identify the team that will work on a scoping review. Because, as I said, this is not a job that could be done by one person, because this is really time-consuming. And we need to select team members based on their experience, knowledge, and skills they could bring into our team. And we need to think in advance what kind of skills we would require from our team member who would work with us here on a scoping review. Because a review team should include the content, methodological and information science experts as well, who would help us to guide, to navigate in the topic we are interested in. And some guidance suggests that the review team include knowledge users throughout the conduct and reporting of this scoping review. And in majority of cases, sometimes consideration of librarian in our team is also useful because they help us in a lot, and I'll try to demonstrate where the librarian's help is very much necessary and very much useful. So these are the steps in conducting a scoping review, which are summarized in 7 steps. The first is to develop, and actually that was, we had this idea from audience, develop a research question and define the scope. The second stage is establish a framework, so-called PCC framework, population, concept, and context, and we will talk and elaborate a little bit more about that later in this presentation. Develop a protocol outlining the methodology, conduct a systematic literature search, screen and select relevant studies, extract and chart key data, and summarize and report findings. So these are key steps.
When you are saying about the develop the protocol of the methodology, what do you mean?
We will describe all the steps in detail. That's all my talk today, nothing more, because we will proceed with all the steps and provide some practical examples how that could be written in real papers, and we will look in real papers as well. So, the first is developing a research question and framework. So that's the vital step, creating a research question. If your research question is too broad, that increases the number of papers for consideration, which may affect the feasibility of the review, and time, of course. If the research question is too narrow, then that may compromise the breadth and depth of your scoping review. Therefore, a preliminary kind of search of the literature may be helpful in determining the breadth of your question, whether a scoping review on the topic has already been conducted or not, because maybe it's already done, and you will struggle with your publication. Any journal would say, oh, there is such scoping review already published, and we are not interested in publication. So therefore, not to waste your time and effort, it's better to look for if there are such publications already exist. And if there is sufficient literature to warrant a scoping review, because sometimes literature are not enough in order to conduct the scoping review. You need data that comes from already conducted studies, already published, from the already published articles. Then, of course, consulting with the librarian can help in deciding if a scoping review is the appropriate review method for your research question to answer. In particular, a librarian may confirm that there is sufficient literature out there, or there is too much, or which will necessitate a more targeted research question. And then, of course, use the PCC framework. What does it mean? That's the abbreviation stands for population, concept, and context. We need to think about who or what is being studied in order to think about the scoping review. We need to think about what is the key issue. This is our concept, defines our main concept of the scoping review. And context, what setting applies? So answering those questions, we might refine, that will help us to refine our research question for the scoping review. Could you think about any examples, for example? Could you?
EMR scoping review, antimicrobial resistance.
Okay. Any other? And what kind of literature would you include in antimicrobial? Because it's too broad, and as we said, if your research question is too broad, you may end up with lots of sources that will create the noise.
We are not restricted. Why? You can choose what you prefer, which your profile, which your direction.
Yeah, okay.
It's up to you, right?
Yes, it's up to you. Yeah, that's why you need to define more, not to narrow down, but not to have it too big, too kind of wide, because you need to come up with the sufficient amount of sources that will give you ability to do the scoping review.
Can you do it? I tried to do one since I'm finished, so that's why
Mm-hmm.
I'm Can you do something like that, like lessons learned from
Yes.
control?
I will bring that.
Antimicrobial resistance, like two generalized resistance in antimicrobial resistance.
Yeah. You could search for the disease that are well known already, probably, that they develop the antimicrobial resistance, and you might look from the prism of those diseases, but you cannot cover all the disease. For example, if we have 10 diseases in our list, you cannot focus on all of 10, or maybe you could focus. It depends on available scientific literature, the amount of available scientific literature, because if it's like millions, you cannot cope with them. You need teams of scoping reviewers in order to accomplish to answer that research question. Therefore, you need to select them, and that's why we skip into next step, which means the protocol development, designing the protocol of the scoping review. We need to provide a clear roadmap for us, for our team members, what is the scope of our review. Early consultation with librarian, as I said, should occur to build this search strategy, because we need to come up, as earlier you mentioned, with the keywords. What are the keywords for our search of the literature? What are the databases we need to look in for our studies, for our source publications, and further refine the strategy based on the papers we found, because that's kind of iterative process. That's not the process linear, you start and finish. You always come back and refine your keywords, because different keywords give you the different outcomes. And you need to come up with the publications which are just matching with your criteria, and which are sufficient for your criteria, which are set in scoping review. For example, you may find too many irrelevant papers. In this case, you may need to review your search strategy to identify the terms which introduce too much noise, which means that gives you irrelevant information on top of what you are looking for. You will also need to define the inclusion and exclusion criteria for the studies you are looking for, which you may, for example, in case of your research question to be back, we might restrict the years of the publications. I'm not interested in 1970s or 80s, but I'm rather interested in like past 10 years, past 20 years, whatever. Still, this is a kind of filter, restriction, which already limits the number of publications that I could access. Then, what could be the exclusion criteria? Also, we could set that so that strictly adhere to these inclusion and exclusion criteria we set for our scoping review. And discussions with your team members. This is very important, because team members are not just those who you assign, review those publications for me if they are meeting our exclusion and inclusion criteria. No, team members are bringing their experience, and discussion is very important to ensure diverse perspectives and that the inclusion criteria are aligned with the research question. And some our colleagues are best in searching the publications in databases, and in this case we could use the help of librarian. Some of them are best in data extraction. Can you imagine how many papers you would end up, your search with lots of papers? And also very important is to ensure the transparency and reproducibility, because all these steps you are processing for your scoping review should be recorded. And as Derico mentioned, there are some guidelines that provide us some guidance how to write up the scoping review results, the paper on scoping review. And I'll try to introduce some of that. So here are the some tools. Some of them are AI-based tools that help us searching the literature into databases. As far as we define the database, probably even we don't know which database would be more suitable for our search. We could ask ChatGPT what databases you could suggest for our scoping review, blah, blah, blah. So, but we know that if we are focusing on health and healthcare topics, then here are multiple databases for you provided with the links. These are well-known: PubMed, Scopus, Web of Science. Also there is kind of nursing and allied health database, ThinHealth, PsycInfo. This is the database for psychology and behavioral scientists. And Also, there is AI-based tool which called Covidence, Ryan, and Elicit. These three are AI-based tools that search for us the literature based on our keywords, and we could, in the same way like with ChatGPT, we explored with Avi in previous hours and previous days. You could use to customize your search based on your keywords. As I know, these slides will be available for you. So here are actual links, and you could use them so that just clicking that will open, that's the kind of path which is included here on a slide. So the suggestion, besides using all these search engines and AI-based supports, suggestion is to use the Boolean operators. How many of you are using or have experience using the Boolean operators? Boolean operators are operators as and, or, and not, which are actually, yeah, I believe a lot of you have experience. Yeah, in PubMed. Okay. Boolean operators. These operators help us to refine our search, to make it more specific. For example, if you are looking antimicrobial resistance, you will end up with the millions of papers, and therefore you will need to add something, another keyword that is important for your scoping review.
For example, and Georgia.
And Georgia, which means I'm looking exclusively those papers that mentions antimicrobial resistance and Georgia together.
Not young people, for young ladies. For
yes, that will exclude young ladies and young generation. And we might, add also and Georgia or Tbilisi. We might add, because it will elaborate, reiterate, and if there are any papers where only Tbilisi is mentioned and not Georgia, we will end up with this search. In our search results will appear
Georgia and Tbilisi, yeah?
Or. Anis, or, yes. So these are the Boolean vectors, kind of advantage.
Sorry to interrupt, Irma.
Yeah.
Keywords are very important.
Absolutely, keywords are very important.
If you don't identify proper keywords, then we cannot conduct the proper search. Because
we need to keep the microphone otherwise.
So keywords are very important. Hello once again. And if we don't identify the proper keywords, we cannot conduct the proper search. So what is your opinion, and what would you advise how to identify the proper keywords, since we are talking about the literature, the search strategy?
Yes, keywords are important. I agree to you. And keyword identification of keywords is the iterative process, because as far as you define some sort of preliminary keywords, they might not work in the way you expect. Therefore, you need to be back again, and with using these Boolean operators, explore which one might work better. Add another keyword. And I'll show you as an example, will demonstrate you the keywords. So many keywords we are used for one publication to come up with the one scoping review publication. We will see some examples of that. So as far as I was asked to finish my presentation within 15 minutes, I need to finish what I wanted to deliver as a kind of in terms of practical examples. So we screen and select those studies. After searching, screening and selection comes. The actual screening doesn't mean just only reading the titles and excluding those papers based on the titles or even based on the abstract. Of course, these are the first steps, but sometimes these are not enough in order to select the proper publication for your scoping review. We might need to read the full text. That's why we are dividing it between our team members. For example, after searching completed, and we end up with 15,000 papers. Of course, it's difficult to screen all these 15,000 papers based on full text reading. Therefore, the first is screening based on title and abstract only, and we divide between our members and assign how many papers could be assigned to each our member. And of course, we are using the Prisma model, which is for scoping review separately. This extension, Prisma extension for scoping reviews, was established back in 2018. It's relatively new. And the checklist contains 20 essential items and 2 optional items to include when completing the scoping review. And as Verico mentioned, the Strobe guidelines, which are for randomized controlled trials, cohort studies, and other observational and experimental studies, guiding us how to properly report those findings from those designs. We have protocols for scoping review as well, which is based on CONSORT. CONSORT means Consolidated Standard of Reporting Trials. And this is the statement for RCTs. Based on RCTs, when you are trying to do the scoping review, this CONSORT sets some guidelines for you. If you are exclusively working with RCTs and doing the scoping review of RCT-based studies. And this, actually the statement for RCTs, using cohorts and routinely collected health data, is being undertaken with the goal of improving reporting quality and setting standards early in the process of undertake of these designs. The principles of charting data is very important because data charting is one big part of the scoping review. The team develops the data extraction form collaboratively. Because, for example, in my case, we used Excel, and it's really excellent tool to design your data extraction form. But you need agreement between your team members, how you will work, and what are the steps for your screening, searching, and selecting of your publication, of your already sources. Although the extraction categories vary depending on the research question and review purpose, common categories could be like author, year, geographical location of the study, study population, main results, study limitations, and probably future directions as well. More specific categories will be needed to capture the data for a given research question based on your scoping review. The extraction form will need to be pilot tested for further refinement and undergo a calibration exercise as well, because you need to test if it works, if it captures what you are looking for. And these essentials, a dyad of reviewers independently extracting data from a small number of papers, example 5, 10, and meeting afterward to discuss any discrepancies with further refinement of the form if a high level of agreement between reviewers is not obtained. So I would like to give you an example. This is a scoping review. I am the co-author of this scoping review, therefore it will be much easier for me to guide you through this publication. This article presents the evolution of HIV prevention intervention research with women who use alcohol and other drugs. So we wanted to understand what is the research type we have in this topic. And yeah, here we have the gender-specific HIV prevention interventions for women who use alcohol and other drugs. And we looked for the evolution of the science and future directions. As I said, the main focus of this scoping review is to identify the gap and to identify what could be the future direction. That was exactly the aim of our study, but in the specific topic, which is gender-specific HIV prevention interventions for women who use alcohol and other drugs. So I'll show you the keywords section. Actually, we used the help of librarian of North Carolina University, and here we have can you imagine what keywords and how many of them we used? We selected 3 databases. These are PubMed, Embase, and Web of Science. We also used specific database, which was our group's database. That included the unpublished literature as well, those who are in process of publication and etc. So here we have the keywords like HIV infections, prevention and control, or acquired immunodeficiency syndrome, because HIV is pronounced in different ways in papers. Sometimes we could use AIDS as well, so depending on that, we modified those keywords, and we ended up with so many.
Why is this time calling?
Well, this is exclusively looking for the text data, text body of the paper that includes within the papers female. Because when we just started screening for the, not screening, but looking for the papers, we ended up with the papers which wasn't focused on women. And therefore we needed to highlight that separately. The women should be used as not only in the title, but in the text as well. So this is the kind of searching algorithm that has been created with the help of librarian. And another version, so this whole, can you imagine how many keywords we used? Okay. And this is also one requirement of reporting guidelines, that you need to be transparent. And transparency means that you need to demonstrate what are the keywords you used, in which databases you searched for, and how you ended up. Here we provide search results. Based on, again, CONSORT guidelines, you need to provide the process, the kind of charting of your process. This is also a very important part of scoping review. So here we demonstrate that in PubMed, using these keywords, we ended up with 300 papers. In Embase, we ended up with 180, in Web of Science 160, and we had the specific database which I mentioned, and we had 37. Based on our inclusion and exclusion criteria, only 680 met this inclusion criteria. 200 and more were duplicates, and therefore they removed. Then the left abstracts has been screened abstracts. We still excluded the majority of them, and you see here the reasons why they were excluded. This means the transparency. When you show why, if you write like based on search, we ended up with 700, but we included only like 20 articles, that's not transparent. Based on what you included only 20 articles in your scoping review, you need to demonstrate, you need to show clearly so that there is no question mark. So here, every single reason is listed, and we ended up with 46 articles which read by all co-authors in full. Full text reading was 46 article read.
But when you do the exclusion-inclusion, you have predefined exclusion-inclusion
Yes, of course.
criteria.
Yeah, absolutely. Based on that, inclusion predefined, inclusion and exclusion criteria, because we divide between us the number of articles, and each of us are using, working independently, and we will come up together, we discuss the results. Okay, I had on my screening bucket like 50 articles, and I included only 5. And I need to show, based on what reasons I excluded the rest of 45. And this is how we come up with the total, with some of the articles we excluded. And can you imagine the total number of interventions that included women, HIV, and including interventions for those women who are using alcohol or drugs? We ended up with only 23, while we started from how many? 680. So that shows that definitely there are more need, this is the gap. Although we somehow, our kind of common sense is that, oh, there are lots of literature on HIV and women, and our expectation is that there should be plenty of literature that covers this topic, but no, we ended up with 23. And here we provide, and here we also describe what are the interventions covered within this article, but that's again based on your scoping review research question. You are choosing those variables you are trying to compare with. So as far as our interest focus was intervention, therefore we needed to show what kind of interventions were tested for women. For example, negotiations, some women's group, these are interventions which we are named in these articles. And this is the final kind of master table of the scoping review, where you put already your findings, and afterwards you are doing kind of coding, because you are reading so many literature, you are compressing them, trying to make it easy, understandable to the reader, so that you frame them based on your thematic analysis. For example, in this case, we compared the studies based on population, setting, aim, description, comparison, condition, and findings. We ended up with 3 generations of the studies. The first generation of the studies that started in early 1990s, when HIV evolved, and the studies cover just very simple HIV interventions. Then second generation that comes after 2000, and the third generation of the studies which are focusing on real interventions of women who use alcohol and drugs. And this has been thematically analyzed and presented in conclusion. And to conclude, just after this example, to switch into yeah. So after example, to conclude, we need to summarize our findings. Once the data have been extracted from all papers and numerical or thematic analysis should be conducted, the findings from numerical analysis can be presented in tables. For example, in our case, the intervention list has been presented in table view. So you need to chart the showcase, the most silent aspect of the review. Readers should be able to see the alignment of findings with the objectives for conducting the scoping review. As I said, thematic analysis consists of examining excerpts of the text and asking how this text relates to the research question, and reflexivity is essential throughout the review process, but especially during thematic analysis with your the colleagues using the memo. So whenever you read the article and whatever, I always advise students to use the memoing process. When you note, to write down your expressions, your feelings, whatever you feel when you are reading something, because that expression and feeling doesn't come next time. So you need to write down all the feelings in order to be able to compile at the end of the process, because you need to highlight the trends in research. And this is how your processing, the digestion, comes up with the kind of wow expressions. So, of course, when we are about to write our report, we follow Prisma guidelines for the scope review and structure of reporting, because when you are submitting your paper to the journal, you need to include if you adhered and what guidelines did you adhere. What guidelines have guided you in writing process. So challenges, what could be in writing the scoping review is that management of large amount of literature is really difficult, and therefore we need to use reference managers. Here I provide some of them. I'm sure some of them are used by you, utilized by you, and know Zotero or Mendeley, whatever. Any of them works. You need to define clearly inclusion criteria, because that guides you in pilot test screening process, and you need to categorize the findings into things, as we categorized into 3 different generations, because we came up with the 3 different ideas. What was the focus of the studies of 90s, what was the focus of HIV studies among women after 90s in 2000 and 2010 and afterwards. Therefore, we came up with the 3 types of generations. This is the result of our thematic analysis. So, to end this presentation, what are the kind of messages, to take-home messages, is that the scoping review is a powerful tool for mapping evidence and guiding future research. They require a structured approach from research question development to data synthesis. A well-executed scoping review informs policy and practice effectively. That's all. Thank you very much.
Thank you, Emma. That was really very large and very interesting review. I know that if you had the time, you would talk much more interesting thing about that, but unfortunately we are limited in time, and I'd like to invite Avi here, but before Avi will arrange all the things, I'd like to ask the audience if you have any questions to Irma, or you have any comments from your experience about scoping review, literature review. And I'd like to ask our audience online if they have anything to mention. Be more active, people online. We really appreciate that you are with us. Yes.
So I'm just interested if you use any AI tools in reviewing process.
This was published
So
in...
many people were involved.
Yes, we were seven co-authors working on that paper. And at the time, it was, when we published it, it was 2015. So we worked during previous year. So at the time, ChatGPT wasn't available. So everything was done based on Excel templates that we've created, we came up with. That's used for arranging the data we have, based on title, population, intervention, findings, and limitation. And that was the final table I demonstrated at the end of the presentation. So based on that, we created something that makes easier for us to get a snapshot what is available in scientific literature and where is the gap. So that's kind of visualizing all the mapping and stuff like that helps you better organize the data, better come up to the final conclusion. So therefore, just only our hands, Excel, and that's all. No AI. Sorry, Larry.
Okay, so we could spend 3 or 4 hours on literature review and AI. In fact, I would say one of the areas where AI is the most helpful in science is literature reviews. And my best estimate, if I had to put money down, is that in a year or two, AI will be doing scoping reviews and systematic reviews almost from start to finish. It is for different reasons, but AI is actually really good at being able, or can be very good at being able to find all, a comprehensive list of keywords. So I don't think that I don't know that we're going to need another year or two to think about every keyword. We're going to review it. We're going to make sure that we agree with the way that it's going about it. But that's going to be automated. And also the finding of all the articles is going to be quite automated. And in fact, I want to show you a few tools now that are already on that journey, that are trying to get to that point. And I think the goal, which they haven't yet accomplished, but the goal of a lot of these tools is to get to what we call saturation, right? Saturation means, how do I get to all of the articles that I need, right, that actually cover a specific topic? And we've been using for many, many years this, Boolean searches and trying to, and going through this process. The process is still correct and the same, right? There's not a change in the fundamental process. The question is, which parts of that process can actually be automated, right? And where do we have an advantage as humans? And where does the deep search abilities, right? Where does that have an advantage? So I want to show you we'll see if we have time for 2 tools, that's great. If not, then we'll start with 1. My favorite one is Undermined, okay? It's a smaller tool, people don't know about it as much. It was built by 2 researchers from MIT who finished their PhD study, said we find trying to do literature search to be very, very inefficient. And is there a way to do this better? And is there a way where we can search in a way where we can actually get to, the results that we want to get to? Okay, so I want to show you exactly how Undermine works. Again, it hasn't gotten to that goal of saturation, which is what we're always aiming for, okay, which is to try and get all the papers, but it can get a decent amount of them. Now, the other thing I wanted to say is that Undermine is searching to understand where it's searching. It's searching within the open access literature. Okay, it's searching the abstracts of the closed literature, and it's it is connected. It's hooked up to PubMed. Okay, so for those of you who are used to searching for PubMed, it's not that different. And it's also connected to Semantic Scholar. Semantic Scholar is just a database. So it's got about 250 million papers. Again, it doesn't have everything yet, which is a shame because that's what it really needs in order to be, to do an entire systematic review. But what I would recommend for now is do your traditional review through Google Scholar with the strategies that we learned about, which I think are really important. And then try an undermine search and see what the overlap is, and see if maybe there are new directions that you didn't find one to the other. So let's take the example just so that we're doing a real live example. Okay, I want to find papers on resistance. We're just going to go with the same example we've been giving: resistance training, impact on post on osteoporosis. I'm sure I'm misspelling that. Here we go. It's okay if I do. Among post-menopause women. And what's going to happen here, interestingly enough, the way that this tool works, and you'll see it here in a second, is instead of going straight to the search, which is kind of what you'd expect it to do, right? Like, okay, find me papers now. It actually almost forces me, okay, to ask me additional questions, follow-up questions, which helps me to refine my question, okay? So I'll get your help here. You know this topic better than I do. Do we want to focus on particular types of resistance training, such as weightlifting versus body weight exercises? I think let's go broad, because I want to make sure we get enough articles here. So any type of resistance training is good. Okay, second question. Or are you open to studies that compare different resistance training modalities? I'm open to comparative studies. Sorry. Additionally, are you only interested in bone density markers, or are you also looking for other outcomes like fracture rates or quality of life? Any of the above are good. Also, would it be significant if studies also discuss safety? Okay, so we're going very broad here. Again, from what we just learned, if you have a topic that you know there's tons of research on, right? So HIV in women, or at least we think there is, then I actually suggest getting more specific, right? And narrowing it down so that, we're not getting too many results. But for now, in this particular topic, I don't know, but I'm assuming it's not a huge, there aren't thousands of articles on this topic, so it's okay if we go a little bit broad. Okay, so what you see here is, what's interesting, there's two actions I can take now. The first one is it's asking me more questions, okay? So it's asking me, do I want meta-analyses or systematic reviews, summarizing evidence? Okay, is that what I'm interested in? Should we consider studies that discuss physiological mechanisms underlying the benefits of resistance training, right? So it's asking me follow-up questions. I can go ahead and continue in my chat with these questions, or what I can do is I can actually go up here, and it's giving me the proposed search topic. So it's refined the way I wrote it, and it's tweaked it based on the answers to my questions. And here we have the refined prompt. The truth is that it didn't change it in my case that much, because I kind of just said whatever you suggested is fine with me. But had I gone and answered the question and said, no, I don't want this kind of study, I only want systematic reviews, it would have updated this prompt accordingly. Okay, and then what we're going to do is we're going to submit a deep search. Okay, so that, again, you might see this term deep search, deep research. That's what we saw with Perplexity a few days ago. What it's doing is it is currently searching over 250 million papers, including all of PubMed, including all of Semantic Scholar, to try and find the best papers. Now, let me explain to you what it's doing behind the scenes, okay, so that you understand. And again, this is similar to what we saw with Perplexity. It is essentially, first it does a simple search of the topic, the same way that a Google would do the search. But then it says, okay, you used the words, right, osteoporosis and postmenopause and resistance training. Let me look for papers that have those words, but let me see what other words, what other key terms you maybe didn't think about that are also connected to this topic, okay, that I can identify from screening all of the initial papers I find. And then let me run another search, okay, which includes those words. And then I'll run another search and another search, right? So it is doing actually multiple searches behind the scenes. By the way, that's why it's taking 5 to 8 minutes to actually run all these searches. And then when I get back are the papers that are fit not only what I asked for, but also what the tool recognizes as those common either key terms or concepts that are shared across those papers. And that's why these kind of tools that take a little bit of time actually work much better in general than, let's say, a generic tool that just spits me out an answer right away. So it's another reason, by the way, if you're doing literature review, don't use ChatGPT unless you just want to find one paper which says what you say. But if you actually want to do a proper literature review, use one of these kinds of tools that takes its time. Okay, so what I want to do now while my search is loading is I give everyone 2 or 3 minutes. You can go ahead to undermined.ai and you can create an account there. It's free. And you can go ahead and start searching your research question, answer the follow-up questions that it asks you, and then hit the search button. And then it'll take a few minutes to generate the report. The one thing you need to have, though, in order to use Undermined is a institutional account. Okay, so you can't use Gmail, for example, to log in for different reasons. But okay, good luck. Yes, I can say one word about that. First of all it's true. There are a lot of tools. We're at a very early stage. There has not, every startup is working on a different challenge. There's a lot of challenges in research, right? There's no one tool, just like there's no one tool currently, even non-AI, that helps us with every single part of our research. We use certain tools. We use, Scopus for finding papers. We use SPSS for doing data processing. We use, Mendeley to manage our citations. It's overwhelming, right? There's a lot of tools. And I don't even know that it's a good thing that one company would create every tool. We know what happens when Google, takes over and does everything for us. Right, there's good and bad to that. I do think that things will get simpler over time. Maybe instead of having to learn 25 tools, you'll have to learn 4 or 5 tools. I'm very cautious when I say, here's the tool you need to use, because a lot of it depends on what your subject area is, what kind of studies you do, what's your challenge. So what I would suggest is, if you remember the beginning of the first day, and I'll send around the slides afterwards, Echo will send around the slides, I did a mapping, okay? I showed you a map of the different tools for different needs. So think about what your biggest needs are, and then look at the map to see which tools are under there. I also just shared in the chat, and I'll try and share, and we'll send around an email afterwards as well, of a product tracker. It's not my own, but it tracks all the different kinds of tools there are. In general, I would say I'm teaching the ones that I think are most valuable, that I've tested when I'm doing these kinds of groups, and people have given me the feedback that they're the most helpful. So you can start with the ones that we're learning.
Can you share this tool with us?
Undermined?
No. The link that you shared with audience.
Yes. I don't know how I don't know if do we have a shared document? We'll send around an email afterwards, I guess, with all the materials. I don't know if we have a shared.
Yes, so today we will collect all the materials, all the presentations, also recordings, and we will share them. What is the best way to share? We will decide, we will let you know by email. Maybe we will upload them on Google Doc or somewhere else, but you will be informed on all these details.
Yeah, I wanted to answer the question in the Zoom. If they ask me what tools I would advise, those which are presented by me, indicated in my slides, those are tested already. Those are working well with scientific literature search, and particularly in health related. So therefore the confidence, they elicit. By the way, elicit changed some, they added some new features. These are AI-based tools where you can search the literature based on your keywords and filters, restrictions you could set for the search, and it gives really nice kind of wrap-up of the report. So this is the new feature of Elicit yesterday that was released, by the way. So these 3 tools are mainly preferable, what I'm using. So therefore, if they're asking me what are the exact AI tools, these are the exact tools I use.
Amazing, great.
Yeah, and what we're seeing here in Undermined is very similar to what you're going to get for Elicit. So it's a lot more a matter of personal preference and taste. I love elicit, I love undermine, so we're not, there's no arguments here, it's just a matter of what people like.
That's based on preferences. Some people prefer such, in such way, sorted data, while elicit provides more structured
100%.
So it depends.
Correct. A lot of it is how you think and how you work. Okay, what I recommend is try 2 or 3 and see which one you like best, and then you can go from there. All right, let me show you. By the way, just out of curiosity, has anyone studied this topic of resistance training, or is that a topic you actually studied, or is it?
Yeah, as Verico mentioned, recently there was a big study, Swedish study about resistance. It was Danish. Oh, okay.
Okay. So it'd be interesting to see the review here and see, how well you think it did. But let's just go through kind of what we get, okay? Because there's a lot of parts to this report, and I want you to understand them. I'm actually going to scroll all the way down to the bottom. Okay, before we get started here, I'm going to scroll down to the bottom so you can kind of see, what we get in this report. So the first thing we get is a list of references. Okay, this should be familiar to us. It pops up with a list of articles that are going to be relevant to our topic. I see here how many articles? A lot of articles. Okay, I don't even know how many are in this list, but it's quite comprehensive. It's quite long. Okay, and it even tells me, if I'm not mistaken, up here. Where did that go? Okay, I'm not sure. I can sift it and sort it in all sorts of different ways. So let's say I want to see I want it to show me the list based on how many citations each one has. So actually what I can do is I can filter by citations, and I can see, okay, this one has 558 citations, 227, 41, 35, etc. If I want to sort it by year, right, what's the most recent studies on this topic? I can sort through in that way as well, seeing the studies already from 2025. Not surprisingly, they don't have too many citations yet because they're still new. And I can sort it that way. But what I like to do, and what I really like about Undermine, which I think makes it unique, is you can actually sift it by match. Okay, match means how close is this article to the topic that I'm actually studying. So you see here that I got 99% matches, but as I scroll down, it goes down. Okay, so this is a 95% match. If I scroll all the way down, I see that I'm already at 70% match. So the higher up they are in the list, in theory, at least according to the AI tool, the more closely they are related to the specific research question or research topic that I asked. Okay, and that can be very, very helpful in trying to understand what are the most relevant pieces of research on this. Now, any single one of these papers, I can go ahead and I can open it up. All right, this is already taking me straight to the Oxford Journal of Bone and Mineral Research journal. Okay, high intensity resistance and impact training improves BMD and physical function of postmenopausal women. This sounds pretty right. I would say that is a valuable hit. That is something that I'm definitely going to want to take a look at. Okay, so this isn't ChatGPT. I don't need to trust it blindly. I don't need to say, well, is it true? Is it not true? Are they making stuff up? No, this is real articles from real journals that are going to be relevant. If it's open access, I can actually download the PDF straight from here. Okay, so I don't even need to go onto the publisher website. Obviously, if it's behind a paywall, I'll need to log in through my institution. And what I get here on the right-hand side is what's called relevance summary. So relevance summary is, why does Undermine think that this article relates to my research question? Okay, so it's very simple to just read through it, be like, yes, I want that to be in my study, I don't want that to be in my study, etc. Okay, now let's go back up to the top and let's see the full report that it gives me, just because I think there's a lot of benefits from understanding the full report. So first of all, it gives me a detailed summary or answer to my question, but it breaks it down by what areas of focus did the different studies look at. So first of all, if we're looking at the efficacy of resistance training on osteoporosis related outcomes, I see here that that bone mineral density, it improves BMD at key fracture prone sites. Okay, and it actually cites the specific articles that relate to that specific topic. Okay, so I can actually zero in and narrow down and say, okay, what am I specifically interested in? What am I looking at? And what are the articles that are relevant to that? Or if I want to look at long-term and site-specific benefits, there's one article that talks about that. I might want to be looking at safety and feasibility. There's 2 articles that talk about that, right? And I can click out and read those articles. So it actually gives me both the kind of high-level view, but also the very specific view of which articles relate to which topics. Okay, it also breaks it down. Part of this report is what's called categories. So in the categories, it shows me, again, specific concepts that I'm going to need to relate to in order to answer my research question, and which articles relate to which concepts. So this is, I would say it's the beginning of a formation of a literature review, or the beginning of a formation of a report, a literature report, or even an introduction to an article that I would need to write is actually starting to be formed here in this report that I'm getting here. And I also like this, I also get a timeline. Okay, so the timeline is a nice way to just see how has this topic evolved over time. So instead of giving me the articles by topic area, it's actually giving me by how the subject has evolved, right? So early research focused, right, were mainly RCTs, established the potential of resistance training, first establishing the field. Then in the 2000s, they started doing meta-analyses in the 2010s, right? So that's also a different perspective, a different way of looking at it. So if I want to ask myself, okay, how do I stay relevant, right? How do I stay, what is the trending topic? What are things that have already kind of, okay, we've established this, and what's still out there to research? It's another way of kind of looking at it. The other, and there's so much here, so I don't want to overwhelm you, but the other thing that you can see here is actually which research groups, or which key individuals, who are the key researchers in these fields that I should be following their work. So here it shows me that there's different groups. There's the Liftmore trials, different articles that were written in that context, the Kelly group, the Vantis group. These are kind of research groups or labs that are focusing on this specific research, and you can see kind of how they are interested, what topics of interest the specific researchers are focusing on. So there's a lot of really, really valuable ways that you can use this report in all sorts of ways. Also here, if I want to filter a little bit, right, so I got a lot of answers. So if I want to filter a bit more, I can say, okay, only give me things that have a match score of at least 78%. Okay, at least 1 citation per year. No. Sorry. And let's say I don't want 1987, I want 2020 to 2025. And now all of a sudden it's been updated. Okay, my search has been updated to only those things. So it allows me to filter it in a better way. And then finally, I can actually export if I prefer to work, if I want to, after I'm done with this, I want to work in Excel because I've got my other search from Google Scholar in Excel, I can go ahead and export it as a CSV, export it as a BibTeX file, etc. Okay, I know we're cutting into lunch, so I want to stop here. What I encourage you to do is when you have a few minutes of brain space and you're not overwhelmed, take a look at your own report, okay? See what's comes up there, especially if it's a field you already know. Okay, if it's a topic of research that you've already studied, be critical and say, is it actually finding the main literature that I would expect it to find? Are there articles here I didn't find that maybe I should have found, right? Or not that I did anything wrong, but just that it finds me things I wouldn't have found otherwise. And keep your eye on Undermined, because every couple of weeks they're coming out with a new feature, and I think they're well funded as well. So I believe they are going to get to saturation. I actually believe that they can get there. They're not there yet. Again, you're going to find articles. You're going to say, well, why didn't it find me this article? So it's not instead of Google Scholar for now, but I think in a year or two, you'll be able to go on here and find basically everything. And that'll be a one-stop shop for your literature search. Anyway, so that's it for literature review. Again, there are other tools out there. If anyone here uses Elicit, you use Cite, you use SciSpace. Sorry, there's in the medical field, Covidence, there's also one by the Mayo Clinic called Open Evidence. Okay, so if you haven't checked out Open Evidence, also really cool, tapped into PubMed. It only will give you answers based on Q1 and Q2 journals. So that's what's cool about using Open Evidence. It's only giving you answers based on what it determines to be the top level research. Okay. also free for physicians and practitioners and researchers in medical fields. So it'll be interesting to see kind of which tools, you know, take the lead in terms of the best results. Again, I show undermine because when I've taught and I do an informal study, right, with my groups, and I say, okay, out of these different tools, which one gave you the best results? Usually undermine comes out on top, so that's why I taught it. But they're all great tools, and if you like using one of the others, that's fine as well.
Okay, great, Avi. Thank you. Can I have the materials with the list of these sources and with some descriptions showing the priority of use of them, each of them, because that would be really helpful. What you just discussed to have some short guideline to people. We are starting the second part of our last day of the masterclass, which is dedicated to introduction to data analysis and programmatic instruments. And we have here three our lovely guests, three professors of Ilia University, Irma, Emily, and Verico. So these three wolves will go deeply inside the process, and they will explain the whole process, how to work with data, what to do, what techniques are useful for developing data analysis, and also they will cover some aspects of electronic tools, how to provide some research outcomes and research process with these tools. I think Emily will start, right? Emily, would you briefly introduce yourself and then let's go.
Hi, I'm Emily. I spoke yesterday if you were here briefly, but I have a PhD in epidemiology. I'm an instructor here at Ilia in the Masters of Public Health program, and I do research on infectious diseases, mostly HIV, HCV, TB, among populations like people who inject drugs and men who have sex with men. So we're going to start by talking about quantitative data analysis, and then Irma will do qualitatively later. So quantitative data analysis, I'm sure many of you are familiar with. It's using statistical methods to analyze quantitative data. So when we're talking about quantitative data, we're talking about basically numbers, anything you can measure or count. Typically, we do two types of quantitative analyses. We can talk about descriptive analyses, which is where you're just summarizing your data. It doesn't tell us anything about a broader population that we might be interested in making inferences to. So for example, we might measure the mean age in our data set. We might want to look at the distribution of gender, things like that. The second type of quantitative analysis that we are typically most interested in is inferential analyses. So this is making conclusions or predictions from our data to a broader population. So now we might be interested in looking at, for example, risk factors for lung cancer in the whole population, not just in our data set, but we want to use our data set to make inferences to this broader population. So what are some of the steps in a quantitative data analysis? So the first thing you have to do is you have to have your data set and import it into the software tool you intend to use. Sometimes your data set will come in one format and you need to convert it to another format in order to work in the statistical software package that you use. So it's important to keep that in mind when you're thinking through, when we talk about the tools you can use, thinking through what format your data set is in and if it can be converted to something that's useful for the tool you want to use. So then the next step, once we have our data set imported into our software tool, we'll be exploring the data and cleaning the data. So this is the stage where we might do some of those descriptive analyses. We might look at how many variables we have in our data set, what variables we have, how many observations, distributions of key variables. And then with data cleaning, and I'll talk a little bit more about what involves data cleaning. With data cleaning, we're going in, we're basically editing our variables and observations as necessary based on if we find errors in the data or strange observations or inconsistencies in how variables or observations are recorded. And data cleaning is probably I would argue, one of the most important things in quantitative data analysis. And actually, I think I've read somewhere that like 80% of the work you do in a quantitative analysis is actually data cleaning. So when you're starting to work with your own data and data set, I think it's really important to have a good foundation in data cleaning and what you can do and what you should be doing, and having different biases that can come into your data in mind while you're doing the data cleaning, and just thinking that through. Also at this point, often you're going to be given a data dictionary with your data set. That's the best case scenario. On the other hand, there's many times where you might be given a data set, no data dictionary, you just have to kind of figure out what's in your data set. So this is the point in your analysis where I suggest that you create a data dictionary. And a data dictionary is just where you define the variables in your data set and any other relevant information about that data set, okay? Okay, so once we've done all that, then we can actually conduct our analysis. I say conduct descriptive analysis, but actually that kind of goes into exploring the data section. But here we're looking at the distribution of characteristics in our sample population in our data set, and calculating summary measures, things like means, medians, and generating any figures that will help us visualize the data and have a better understanding for what we have available. Okay? So again, it's really important to familiarize yourself with what's in your data set and what's relevant for your analysis. Finally, the last step, and often one of the quickest steps, is the inferential analysis. So this is where you're doing things like statistical testing, t-tests, chi-square, ANOVAs, and any regression modeling or advanced analyses at this point. And that sort of goes beyond what we're talking about in this class, but I believe Verico is going to be showing you some output of what some of these things might look like in some of the statistical packages. Okay, so I mentioned data cleaning. I just wanted to show you what it kind of looks like to go from a dirty data set to a clean data set. So in gray, you see that's the dirty data set. What we see is that within each column, the variables are measured in different ways. So you can see the dates are written in multiple different ways. Genders, some say M, some say fem. Again, different ways, same with age. So with data cleaning, we want to go from that to having consistently measured responses for each of the columns. So you can see now in the, is there a laser pointer on this?
Yes.
Oh. Okay. You can see now that male and female are now written exactly the same way. We got rid of the uppercase M. And age is consistently written, the dates are consistently written. Okay, so that's one example of what you're doing with data cleaning. Additionally, what you can see here is that the column names or the variables here, the variable names have been edited to be consistent with coding best practices. So that's another thing I'll mention here, and what you can hopefully explore a little bit on your own is coding best practices, because often you're not working on a data analysis on your own, or you are working on it alone, but you're working on it with your future self. So you want to make sure that you're clear on everything you're doing and consistent, so that whoever else is working on it understands what you've done can also easily go in and work with this data set. Okay, so I mentioned a data dictionary. I'll just briefly talk about what goes into that. Again, because I want to focus on cleaning and data dictionaries and these aspects of analysis, because I don't think we have time to get into specifics with statistical analysis, but these parts I think are often forgotten when you're taught, you know, biostatistics and you're taught a software package, and these are some of the most important aspects of data analysis. So, what goes into a data dictionary? This is going to include all information on the contents, structure, and the layout of your data. So at a minimum, it should include your variable names, description of what those variables are. Also, if you, I don't know if I mentioned it here, but if you change your variable names, as I showed in the cleaning, you want to make sure that you have both the original variable name and the updated variable name. Why? Because if, for example, you're working off a survey, you want to be able to go back to see, okay, I changed this variable name, what was it in the survey? Or when you're working your data, you need to know what the updated variable names correspond to. Okay, and then if the question, if it's from a survey, you want the question associated with the variable. And if the variable was created using other variables in the data set, you should include which variables were used to make it. So, for example, well, let's look at those data sets. Imagine you wanted to calculate a variable that showed time between age, or date of onset and current age. So you would have what I call a derived variable. And in your data dictionary, you would indicate that it's based on these two variables. Okay? You also want to include the values that the variable stores. This can be things like yes, dates, a range of numbers. For example, if you're talking about age or BMI, things like that. Other information you might want to includes the number of missing observations, so non-responses to questions. Missing data is also something that's really important in your analysis and can have implications for any biases you might have and what analyses you can do. If the variable is part of a skip pattern. I'll talk about this in the survey design section, but keep this in mind because skip patterns can result in missing data, and so you might look in your data set and see, whoa, I have half the observations are missing on this variable, but it might be because of a skip pattern. And then any additional relevant notes. Okay. All right, so tools for quantitative analysis. We're going to talk about 4 today, SAS, R, SPSS, and STATA. There are others, of course, but these are some of the most commonly used ones. So I'll first mention SAS. Just very briefly, it's a quantitative data analysis software, obviously. It's previously been really commonly used in the US in government and industry. And because of that, it was often taught in MPH programs, at least I know in the US. But actually R is becoming a lot more common now. And I think globally as well. So SAS can do most of the basic statistical analysis that you want to do, including things even like machine learning. One limitation of SAS is that it's based on whatever SAS has available, because the code is written by this company. It's not open source. And I'll talk about R in a minute, which is open source, and there are some benefits to that. Finally, a major downside with SAS and some of the other programs we'll talk about is that they're expensive. And here I'm just showing a screenshot of what SAS looks like, what the user interface looks like. So here you have your data entered into your libraries here. You write your code down here, and you get output from code up here. Okay. All right, so that's all I'm going to say about SAS, because you'll be able to tell which software I prefer based on this, but Now I'm going to talk about R, which is really what I primarily use. So R is, according to their website, a language and environment for statistical computing and graphics. All that is to say is that it's basically another statistical analysis software, though it's a lot more flexible and can do a lot more things than your standard statistical analysis software. So that's R. RStudio is a user-friendly interface to work with R. Okay, so it's basically the you can actually do your coding in R, but it doesn't look as pretty as if you do your coding in RStudio. Yeah. So the best thing about R is that it's free and it's open source. So any of you, yes, you can download it. I'll show you the links. You can do it today if you want and start using it right away. Open source means that anybody can write their own code and publish it. With a caveat, I'll say that in a minute. So R, as I mentioned, R is the main program. RStudio is the interface. And here are the links. So I think you can probably Google it, but if these slides, I think we're going to share the slides. You'll have the links here if you're interested. The first one is R, and the second one is for RStudio. Okay, so this is what RStudio looks like. It looks complicated, but it's, once you get the hang of it, it's quite easy, and it's similar to your other programs. I mean, the spaces, the rectangled areas are similar to what they are in SAS. We have the source pane. This is where you type your code. There are scripts in R. The console pane is where your output is printed. This is the environment pane where you'll see your data sets and any variables you're working with. And then here on the bottom right is the plot packages and help pane. So that's pretty self-explanatory. This is where plots, figures are printed. Any packages, I'm not going to talk about that, but R works with what are called packages, but you can find them here. And then help, you can get help there in that pane. Yeah. So, what are some pros and cons of R? Pros, it's free. Another pro being, I think, is that it's open source, so it makes it a very flexible program. As I mentioned with SAS, you're limited to whatever SAS deems important for being available in a statistical analysis package. With R, anybody can write whatever they think is necessary for analysis. And I'll talk about some advanced uses of R in a minute. These advanced uses are possible because of this open source nature. And because of this, you can do many types of analyses. It's sort of redundant, but it's very flexible. And it's becoming quite popular among data analysts and researchers, so I think more and more it's becoming the main program to use for health researchers. So I think we're going to be seeing R used a lot more in different organizations, and I think it can be useful to learn, especially if you're interested in collaborating with organizations abroad, for example. So some of the cons, this is, even though I said, we're limited to what SAS has available because it's one company and they decide. A con of R is that there isn't a big company that's backing the code here. So bugs in the code can slip through more often than maybe it would in a program like SAS or SPSS. But I will say there is a check on who can publish code, and through the R community, it does have to be verified before any code can become available for the public. And another could be considered a con. There are usually multiple options for doing a particular analysis. So even just doing some, like negative binomial regression, there are multiple packages available, multiple functions you can use to do that analysis. So you kind of have to wade through, and sometimes you'll notice too, you find something and you're like, this is the perfect code for what I want to do. And it turns out it hasn't been updated in like 5 years and it doesn't work anymore. So that's a con. Okay, so just briefly, I think I've gone over my time. Some advanced uses of R. One is mathematical modeling, or this is also called transmission modeling, infectious disease modeling. You may have heard of things like SIR models, maybe susceptible, infectious, recovered, those sorts of models where you simulate a population disease spread through that population. You can do that in R. I don't believe you can do that in any of the other statistical analysis packages we're talking about. You can do network analyses. You can do economic forecasting and modeling, machine learning, geospatial analysis, and you can even do app creation through what are called shiny apps. So I've just included some links here for self-learning in R. I highly recommend DataCamp. Unfortunately, there is a fee. It's not outrageous compared to like what universities charge, but DataCamp is just really great because it simulates the R environment and you basically are typing the code in as you would in R. But there are also lots of free resources. So these are Coursera and EDX. There's also the internet. And even if you're not using R and you're using another program, the internet is your friend. And I'm sure Avi will give good ideas for how to use AI. I've included as well Gemini and ChatGPT. But there's lots of like Stack Overflow, these R bloggers, Reddit even, YouTube. So, there's so much out there. So really self-learning is possible with R and these other software packages. Okay, I will let Verico take it away.
So another statistical package which is widely also used, especially in Georgia and many other middle-income countries also, is SPSS, because SPSS is quite expensive, but the packages that are available for installation can be found through different websites. What do you call such kind of packages when they actually don't have a license, but you just steal them and use them? Pirated versions, yes. So there's a lot of pirated versions of SPSS. But this is a link to the kind of legal version of it. It's created by ABM, and this is a statistical software, as I said, used for social sciences in the beginning, but it's quite good statistical software for the quantitative data analysis as well, not of any kind of biomedical research. And it features a user-friendly graphical interface suitable for beginners and experienced researchers, allows efficient data handling through the editor, syntax comments, and output viewer, which I can show you, compatible with multiple data formats. And what I mean here, you can import the data if you have the database in Excel, in CSV, in text files. You can do the same with SAS and with R as well. It supports various statistical procedures, including descriptive statistics, regression analysis, ANOVA factor analysis, chi-square, facilitates straightforward interpretation of results through tables, charts, and comprehensive output reports. So this is, it has two views. It has a data view and variable view. This is a data view where each observation is relevant to each row, and this is just a TB case code, this year of TB diagnosis 2021. Then you have diagnosis date, then you have a gender, 1 is female, 0 is male, and then you have like birth date of birth. So each row represents one particular observation. If it's individual-based data, then it's one individual. If it's case-based, then it's per case. Then we have the variable view, which is kind of similar to the data dictionary, what Emily was talking about. You can keep it right in the program, and that's kind of a pro of this particular statistical program. In this data dictionary, you just have list of variables, then you have type of variables. The white you don't really need, decimals you might need if you want to keep some kind of continuous variable in a decimal format. Then you have a labels, where you can explain each variable, what it means. Then you have values. You can code the values. For instance, you can call 1 is male, 0 is female. Then how missing values, if you have any, and and then you have here kind of measures, whether the variable is nominal, scale, or ordinal variable. So it's kind of data dictionary is inserted within the program.
So it's not separated like in...
You can do it anywhere, to be honest, in SAS, in Stata, but it's just the viewer friendly if you're a beginner of using the statistical software. I don't want to recommend it too much, but usually it's quite user friendly, and when you look at it, it's nicely kind of previewed to you, so you can easily modify it. And everything seems clear and not scary. It doesn't look like a complicated code or something like that. And I will compare it to Stata, and you will understand what I actually mean. And this is an output, and look how nice it is. It's multiple colors, very well delineated. Very well delineated. It just shows like two groups. What I did here, I basically compared the age across two groups, which is female and male. In that particular database, age is a continuous variable, female and gender is a nominal variable with two outcomes. So I used the independent t-test, and this just shows here the number in the male group, number in the female group, then shows the mean age, and then just compares whether this difference in mean age is statistically significant. There is an interpretation of t-test, whether it assumes equal variance or variance, or doesn't assume the equal variance, and then whether the difference is statistically significant. And it goes even further and says if there is a statistical significance, what is the magnitude of effect. And this is interpretation of the SPSS output. Since the main theme of this training or masterclass was the AI involvement, I must say that I right away asked, copied and pasted this particular photo screenshot into the ChatGPT and asked them, please interpret the data. And that's the interpretation which came out from the ChatGPT. I didn't even change it. I read it through and I completely agree with that. So it's a detailed interpretation of this particular output.
If you put this in ChatGPT?
You just put this. You just take a screenshot and just put it in the ChatGPT. I just played with it, and then I asked, please interpret the results.
Sorry.
And they just interpret the chat. Yes, go ahead.
Do you have a free version or you're using paid ChatGPT?
SPSS has.
No, I'm asking about ChatGPT.
No, ChatGPT. I have a paid version.
Paid, yeah.
So I didn't try the free, but Avi perhaps will know if free version does the same. Yeah, but paid version did the interpretation, and I completely agree with it. Then I even went further, and then independent samples, effect size. And then this is kind of a new what you don't routinely teach, for instance. And I just even asked the ChatGPT, so how what additional value does it have? What does it give to me? And then it goes, it interpreted quite well. I just didn't include it here, but it's somewhere in the comments, actually I did include. I wanted to show that also, but I don't think we have time for that. Anyways, you can ask for further explanations of the output. Now I will move to the status, and it comes from the statistics and data. Right now I personally use Stata quite a lot, although I'm also trying to move to R because of Emily. We are teaching the same students, and I want to teach the biostatistics in R, so I played with it, and it's very nice and interesting. So, Stata is widely used in epidemiology, economics, public health, social sciences. Like World Health Organization was using the Stata, but now they are moving to R as well. It also allows import-export of data. So this is good, like all other statistical programs. Provides robust data management, statistical analysis, and graphical visualization. In terms of data management and coding, I will show the screen shots. It depends what you get used to. Like the same can be done in R. Even SPSS has a syntax where you can code. You just need to get used to the statistical coding language. Excellent scripting capabilities. Like Stata is quite intuitive as SAS and apparently as R. So they are quite intuitive. Who has been acquainted with one of the programs listed, they can easily learn another. Supports advanced statistical methods, regression, survival analysis. Missing value imputations can also be done in R. In Stata, as well as in R, efficiently handles large data sets with professional quality graphs for the publication. That's true. With SPSS, it gets slow when you have large data sets. With Stata, you don't experience this problem. Now, if you look at the output, there are several windows in Stata. I showed two of them. One is the output window. This is a do file where you actually write the code. Unfortunately, didn't choose the right screen shot. In the do file, you actually write a code. And here you can see the variable list and you can see the output itself. And this is the same output what was shown in SPSS. And as you see in SPSS, it was in colors, very well delineated, so it was easy to read more or less. Here it says the same, with the same test used, just the t-test used. It doesn't really show you the effect size, but it shows the same. I just had this data already recorded, so it nicely shows male, female, number of observations, total how many observations, then mean age, standard deviation, standard error, standard deviation, and confidence interval. And then it just shows the difference in mean, while I'm looking there, and t-test value here, and statistical significance. If you just put that into the ChatGPT, just copy and paste the same output from Stata, ChatGPT does the interpretation again. I copied and pasted from ChatGPT, I read it, it does the same quite good interpretation, just showing and describing everything, even giving the conclusion, which you can modify with your words, and then include into the paper. If you agree, of course. If you disagree, you can try yourself. But that's what it does. This is a simple t-test. I'm not sure if ChatGPT can do all of what Avi might tell us with the more sophisticated statistical analysis. But with a simple t-test, just comparing two means, it worked quite well and was quite time-saving.
So you are giving data to ChatGPT?
No, I'm not giving any data. I'm doing this analysis in Stata and I'm then just doing the screenshot, uploading in ChatGPT, and saying.
Ask the interpretation.
Yeah, just interpret the findings, so interpret the output. You do that.
Yeah, but most difficult part is interpretation, because most difficult part when you do the analysis is the interpretation of the data.
Yeah, choosing the right test and then just interpret it in a concise way, so you can include in the publication. This is also ChatGPT, what you see here, even with this red and green things. I just asked the ChatGPT, please compare pros and cons of SPSS and Stata. Just give me the comparative bullet points for the PPT slide. That's what I asked, and that's what it showed to me. I, of course, reviewed it. Actually, it had several versions until I reached this particular version, which I'm presenting to you right now. And it says like user-friendly. Well, on the way while I was using, kind of creating this slide, I was giving like kind of highlight that Stata is more powerful in terms of programming, and highlight that SPSS has a good kind of interface, easy to read, and something like that for the beginner. So just giving, I don't exactly remember what was my script. I can check it in my laptop, but that's what I did. So here we have like SPSS user-friendly, intuitive graphical interface from visualization and reporting tools, widely used in social sciences, health and education. Limitations, flexibility for complex analysis, not ideal for very large database, expensive licensing options, and powerful scripting, view files, advanced statistical modeling, widely prepared in epidemiology, steeper learning curve due to the scary interface, other than that it's quite intuitive, effectively manages large data set and complex analysis, licensing can also be expressing, so offers multiple pricing tiers. Yeah, so that's it from my end. So, but what I wanted to highlight just first, a kind of descriptive presentation, and which doesn't really involve like research insight or finding something new. ChatGPT has been really very helpful and time-saving for me when I was working on that.
Thank you, very good. Now Irma will finalize.
It's time for the qualitative analysis and qualitative software. Qualitativists, we are blamed that they are subjective because they do not have means to prove that their findings are statistically significant. So we don't need that because we do not test hypotheses when we're doing qualitative studies. So it's very important to choose the methodology. What question do you need to answer? That actually guides you which methodology would be appropriate for your research question. So therefore, we choose qualitative study when we need to explore some experiences, find some meanings, explore the behaviors when we do not have any information about the phenomena that occurs, phenomena that could be rare, and we try to explore it and answer the questions why, for what, rather than how many, and I don't know, some in terms of quantitative. We are not trying to answer the questions which are related with the quantitative kind of data. Although, to some extent, there is some way how to conduct the quantitative analysis of qualitative data and vice versa. So that's kind of the question that should be answered by the researcher, defined by the researcher. So definitely, excuse me, the qualitative study focuses on understanding human behavior, social interactions, and lived experiences rather than measuring some variables. And the means to collect the qualitative data, I'm sure all of you are aware of them. These are the in-depth interviews, discussion in focus group, observations, which could be intrusive or passive observations, indirect or direct. These are the working with the textual data, because your data matrix is just words, just text. While in quantitative data, you have the data matrix, where each cell is filled with the numbers, only numbers, without letters. Letters are kind of, when you put letters, it could say like it's corrupted value for the cell. So, and yeah, the aim of the qualitative study to answer the questions like why, where, for what, and etc. We call these open-ended questions. Yeah, these are graphic descriptions of what we are doing with the data of the qualitative, that comes from the qualitative studies. These data are the texts, we call it transcripts from focus group or individual interviews, or even transcripts of the observation. They are in the form of text. Our kind of aim is to, oops, okay. 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 Sorry for this inconvenience. So the idea is that we have tons of the data in terms of text, which we try to decay, to divide into different pieces, and again compile them back in the way we prefer to be compiled. So this is the process, iterative process. This is not a linear process. When you are finished with one interview transcript coding, no, you are back after several transcript coding because some new codes emerge. So what is the coding? Coding is the process when you are labeling the given information, what you have in your transcript, based on your research question, based on what you are looking for, what you are searching for in given data, given text. So it's exactly the graphic illustration here. It exactly illustrates the process. We are dividing all our data and then again collecting it, merging it in the way we prefer and we choose. So that's called coding. We code each our piece, chunk of the data, and then organize them into categories so that our codes are categorized, and those categories again are categorized in core category or in themes, in topics, so that we try to understand what are the connections and relationships between those codes that were created by us. Sometimes those codes are hierarchical, which means big category of our core category of codes could have so-called child codes. And that again depends on the study and the research question. Based on that, you might end up with hundreds of codes. Sometimes there is no need to code the data verbatim. We call it like word by word coding. Rather than you choose the line coding or thematic coding. So it depends what the method of analysis you are choosing. Here we have the coding approach for the grounded theory. When you have different codes, you're organizing them into categories, and these categories together are giving you the patterns, and these patterns giving you kind of description for the grounded theory. Grounded theory is used when I am not aware of the subject and I'm exploring and trying to explain the phenomena. Therefore, the coding approaches also are different. If you ask me, when I started the research, it was back in 2003, 2004. I don't remember at the time, and Vivo or any others were available or not, but in 2008, I started using Atlas T. But this is the process we used to. This is not me, exactly, but this is the process that actually some of the researchers are preferring to use the exact coding by hand rather than using different softwares. If you ask me, I prefer to use softwares because that makes you more efficient in time and it really saves lots of time and organizes data in the way you prefer to be organized, which takes relatively a lot of time to compare with the quantitative data, cleaning or organization of your data. It's relatively time consuming, and even there is no magic there in software use except of doing your work in an efficient way, which is the coding. Software will not do any analysis for you, like there is no magic button that you hit and it gives you p-values and outputs. So these are our brains. Our brains work as a key and key button because we process, we digest. It's the process that goes over months, probably. If you are working on a qualitative data analysis, you need to work on that constantly without interruptions, because that will cost you a lot of time. Because when you leave your work and you are back after a month, you need again to recall everything, remember back, and you will spend just lots of time. Because your brain as a researcher still processes all the information, even if you are not working with the software or if you are not working with your transcripts, you still process, you are still thinking all the time. And when you are back to your work, you already know what to do, how to process any further process. So what we see here, transcripts, and they are labeled with sticky notes. This is actually the process that could be done electronically as well. All the softwares provide you options to label the part of the transcripts with your kind of expressions, emotions. And I always advise students, when you are reading first time the transcript, whatever emotions or ideas come to your mind, record them. And this option is easily available. You are not writing down in a notebook where you need to, for example, if you have plenty of pages of notes, sometimes you struggle to remember, oh, where goes this note? Why I did this note for what? While in electronic versions, you are sticking your ideas and you're thinking where it came, where it rises actually, in the place where it's applicable for you. And this is really nice feature. Memoing, noting, this is electronically done perfectly. So this is the version I used to do when I couldn't afford any software because still they are costly. Now they are switching into yearly licensing. Every year you need to pay for license rather than buy like lifetime version of the software, which was prevailing before like 2000 maybe 15. So this is the transcript, which is written in Word format, and in hand these any sort of paragraphs were labeled by the researcher. But if you are dealing with 50 in-depth interviews, you cannot remember all your labelings in the transcript, in the paper. You will lost in your papers, in between the papers. Therefore, these softwares are helping us. This is the example from my experience when still I couldn't afford the costly softwares. I just used Excel. If you come up with any ideas, I'm really glad to pick up that idea, and probably I would have some ChatGPT related ideas, and I also explored some, and I will share that experience with you. So here I put, somehow it doesn't show up the full page. That is kind of in a bottom line, you have the spreadsheets, the names of the spreadsheets. I just renamed them according to code. So the codes are the sorting the information you prefer, and I sorted the given transcripts in the way like the part of transcripts, and they collected these codes according to in the Excel spreadsheet, naming the one spreadsheet with one name code and putting there different chunks from different transcripts. So therefore, it's better rather than kind of working with the papers on the floor. But if you have ability, of course, using the different softwares will give you efficiency and will save your time. So in majority of cases, researchers prefer to work with NVivo, Atlas Team, MaxQDA, Deduce. Currently, I'm working with NVivo, and there are some pros and cons because all these softwares are English softwares, and although there are some language packages available, for example in NVivo, and all the time they try to expand their language abilities, still there are some pitfalls, and I will share that with you. And there are many others, but from these others, the green, highlighted in green, these are free of charge softwares. And what I advise to use to my students is the last one, Saturate app, which we will go through, which is really nice, with limited abilities, but still better than using Excel for coding. And it is so easy to use. That's the best option today available. The only requirement is to have Twitter, currently X, former Twitter's account. So, and of course, by hand, doing by hand, all the experience never gets old, and by hand doing coding is still on our agenda when you don't have any tools. So, to be back to the role of qualitative software analysis, software tools help researchers to organize, analyze, and interpret a large amount of textual, audio, and visual data. These are new advancements in software, qualitative software tools, when you don't need transcripts and you code just directly the video or audio files. That's also kind of nice tool, nice option. They facilitate coding, categorization, and pattern recognition to enhance rigor and efficiency in qualitative analysis, and commonly used in thematic analysis, grounded theory, and discourse analysis and case studies. Still, there are some questions. Why use qualitative software? To be time efficient, to enhance accuracy and consistency in coding, supports data visualization, which is a really nice feature of these softwares, and I will show you some outputs from the qualitative software, and it really supports thinking process of the researching, because you are getting different visual, some outputs from the qualitative software, and that helps you to be more, to be sure that you are thinking correctly, you are processing your data correctly, although it doesn't generate p-values. Still, there are some abilities to generate intercoder reliability, which helps you to justify that your finding is not subjective, and there are some objective measures with the so-called kappa. So kappa coefficient, which is the measurement of agreement between two different coders. Because you could work, two different people, two different coders, work on the same data, so that they agree between them what is the coding pattern they should use, or maybe even predefine this set of codes and then code the given material. Then when they are back, they are comparing which part of transcripts we are similarly coded and which not. Therefore, we could measure the agreement between those two coders, and this is the reliable measure for the qualitative data, and it's called the intercoder reliability, and it's measured with the kappa coefficient. So, therefore, software allows you collaboration and multi-user functionality. There are some cloud-based softwares, and in parallel, different coders could use the same data so that they work together, and this is supported by the software and enables mixed methods integration by linking qualitative and quantitative data, because you could import the Excel-based data, for example, some demographics, and you could link those data with the expressions that are given into transcript, so that you are creating linkages between your quantitative and qualitative data. So here are basic features, comparison features of software tools, those main software tools, which are NVivo, Atlas Data, DOS, and MaxQDA. All of them are working the same way in terms of coding data and finding the relationships and linkages and etc. The main difference is just interface and also some capabilities these softwares provide. For example, the NVivo is good for complex coding and academic research. It is good also, and as well as MaxQDA is good for the network analysis. Network analysis is a kind of analysis when you are trying to measure the connection between two events or two persons, and what kind of, to what sort of strong relationships are between them, and how that influence on behavior and etc. So this is not available in many other tools, but those two, MaxQDA and NVivo, are really strong to meet your expectation in network analysis. So good thing is that the data types that accept NVivo is text, audio, video, and social media. You just can import from the Twitter. I still like the Twitter or many other social platforms. The important keywords with using hashtags, so that you always can import any data from software analysis to software analysis to software. So the one thing when you need to decide which software could be useful for you, I would advise to think about the research needs, data types that will be available for you, and budget as well, and accessibility, and also the time that you should invest into learning of the software use, because not all of them are so easy to use, user-friendly, and you need to weigh this thoroughly in order. Maybe it doesn't make any sense if you have like just only 10 interviews to analyze. Maybe it doesn't make any sense to study NVivo, to invest money and time on that, and go with the free version of Saturate app. Maybe that's the better option. So that's up to you. So just to conclude and take some messages from here today, qualitative software tools have transformed research methodologies by making analysis more efficient, structured, and accurate. They do not analysis on behalf of us. are we researchers who are doing this analysis. Each tool offers unique strengths, whether in complex coding. Right choice depends on your research approach. And also there are some guidelines how to report the qualitative data. And this link is provided to just to follow the guidelines in case you have if you plan some qualitative article publication. This guideline will help you how to articulate the findings from qualitative findings. So here is an Excel, by the way, but that was back when NVivo didn't support the intercoder reliability calculation within the software. You needed to get some data, coding the pattern and coding sources, output to get from the software, then import into Excel, and using a very simple formula you could calculate the agreement percentage between two coders. So here you see the position of the word in this sentence. This is the query you could ask the software to find the word, particular word, and I intentionally bring here Georgian output. Yes, you can upload, this is from NVivo, you can upload in any software Georgian transcripts because it supports, it's called the UTF-8, the script of the Georgian language, but it is limited in case you need to search particular meanings and particular synonyms. For example, in English, you could indicate the words in different meanings, how it's mentioned in transcript, but in Georgian you are limited. The only thing that you can do is to exclude the words that you don't need to have in outputs. So here is the, for example, again from my studies, word methamphetamine, and you define how many words you would like to see prior and the next after methamphetamine, so that see the position of the word in the sentence. And by the way, this is interactive. When you come up with each, for example, but the goal is always methamphetamine, it shows in which direction it will continues, so that you are able to read the real position of the methamphetamine. Yeah, and the shear, yeah, and it becomes bigger and bigger if the, and the tuft, if there are too many of those words. Here I have the word cloud, that's also output from the software. When you ask first, for example, give me first 100 words that are very frequently mentioned. And here you see magram, zania. These are words which are other parts of the sentences which are not important. And in English you just click the one button excluding any or, and etc. But in Georgian you need to indicate word by word which words should be excluded, but still good. And this is the pitfall of the language, I would say, but still manageable if you indicate exclude those words and type in Georgian magram to magalitad and etc. It will exclude, and later you will have better filtered version of the cloud words. So this is the another query.
Just a question. So can be this word used for identifying the probability, like if it's sometimes if it repeats many times?
Yeah, you get any you will get any word, whatever you indicate, how many times it's been used, like, and in how many sources.
Not necessary to exclude, but they still can show something.
Yes,
which
that's another. That depends. Absolutely agree. That depends on a research question. So if you are actually okay with this, yeah. But that wasn't my kind of idea to get the frequent words. But then I discovered that there are some abilities to indicate what is your interest and to narrow down the words so that it doesn't give you unnecessary words. So you could ask, this is another query in NVivo, source clusterization based on words used, and you could indicate the words, what are your interests. As far as these studies were on stigma and discrimination and violence among women, and this was the particular interest. You see the next kind of blocks here. These are the sources, the in-depth interviews or focus groups, which are clustered in the similarity of using these three words, which means the similar type of colors, they are similarly coded with the word stigma, discrimination, and violence. And we see here red and blue and sky blue. Those are relevant. So this is absolutely coded differently. And this, what does it give us? It gives us opportunity to look at how similarly the distribution of those codes are occurring in these sources what we have. Again, this is source clusterization based on coding similarity, and as much as they have connections, this means those interviews are very similar. They contain similar problems, while these are absolutely different. And that gives us again the kind of indication, guidance. Okay, let's discover what are the differences between them. And this is kind of visually seeing the results of the coding. Again, this is very busy, I know, but it's interactive again within the software, and you always could do. Yeah, by the way, the notes indicates codes. Somehow this is the how this company and NVivo calls codes in the software, nodes. So here we have different nodes, the one big node, for example, drug of use, and there are different child codes, and actually this is big category and subcategories here. Yeah, that's it.
So, we have Wow Day today, right? So the presentation of this week.
I just forgot, sorry. I just forgot to say.
Avi is coming, yes.
Yeah.
Join us.
Avi's part, actually. I forgot. R, what was mentioned by Verico and Emily, included the qualitative package to work with, which is free software, but it wasn't updated for a long time. I checked and it's still the old version, but probably there are some hope that someone would be interested in updating the qualitative package in R. But and the Saturate app, which I offer here, it's really easy to use, and you just need 10 minutes to learn how to use it. You just code the text. And also I asked ChatGPT, what could you do? And one thing is that very nice Google recording application records your voice, which transcribed within seconds, but it's in English. Unfortunately, Georgian transcription still is under development. There is one Georgian company who is working on that, and there is a beta version, but still it's doing horrible work. So therefore, doing transcription in Georgian by hand is better rather than using that software. But if you are working with English transcripts, then good thing is that you can upload. What I tested and I would like to share is that if you're working on a health program evaluation, for example, you could upload those transcripts and give some description.
So video file you can upload and it gives you transcript, or?
I said the voice recording. Yes. Yeah, voice recording, audio file will be transcribed within seconds. Then this is the Google recorder. It will be available in your Google, as you are accessing your Google Photos, you are accessing in the same way to Google recordings. And you just click and please give me transcript, and it gives you transcript within a second. But it's in English, not Georgian.
Is it possible to do coding to ask the ChatGPT?
Yes, seems like they are doing the coding, but I never used that option from the ChatGPT. The only thing that I liked uploading the transcripts and asking just outline in the way you would like, and it gives perfect outline. That was my experience with the ChatGPT.
By raise of hands, who here does quantitative work? Okay, and by raise of hands, who here does qualitative work? Okay, all right. Okay, so let's start with the quantitative tool. Okay, and then we'll see if we have time. We'll go into qualitative as well. Okay, all right. Let's see what we're able to do. Sometimes we don't want to. Yeah. Okay, so let's get started here. The tool that we're going to learn today, you're welcome to sign up for it while I'm getting set up. It is, here we go, I'm going to just be able to do this with Google. It's called Julius AI. Okay, so Julius AI is the name of the tool. And I will be happy to show you how it works. It is my favorite tool for quantitative analysis. Yeah, I think we're good. So, all right. So, as was mentioned here, AI can be very helpful in both quantitative and qualitative analysis. We're going to start with quantitative. Again, we'll see if we can get to qualitative as well. Quantitative analysis it's interesting because you would think that AI would be very bad at quantitative analysis, because I've already told you that it's not good at math, and also that it hallucinates, right, and makes stuff up. So that's definitely not what we want for a tool that we want to be trusting with our data or to analyze data. And yet, as the panelists correctly mentioned, you can actually do some pretty cool stuff, even with GPT, without any other special tools, with GPT inside GPT. So why is that, and how does that work, and why should we trust it? The answer is that what's happening, it actually goes, when you ask to run any sort of data analysis, it is performing a different action on the back end than when you're asking it to answer a question. Okay, it's actually doing two totally different things. So if I mentioned before that GPT is just making a big word salad of all the words and then spitting something out to you, the data analysis works a little bit differently. Essentially, what it does is it turns your natural language, let's call it, right, or anyone's ability to ask something into code. So in the back end, it's actually generating code. Okay, you can actually see this, I think, if I'm not mistaken. Here, let's take a look. Here, you know what? First we need to, let me just open up my data set so that we can have something to work with. Here we go. This data set, by the way, for those who don't feel comfortable sharing their own data sets when we do practice, is publicly available. All you need to do is search for poverty headcount ratio at $2.15 a day. That's a publicly available data set via the World Bank Group, who I believe is a partner in this, right? So there we go. It all works out well. And I'm going to, here on the right-hand side, you can download a sample data set. So I'm going to use this. And what I'm going to want to do is, so if I just say, so I'll show you first with GPT. Please tell me what's in this data set. Okay. And you see here the analyzing. Okay. So when it's analyzing, it's essentially reading the document. That's doing the data. That's a slightly different process. Okay, it's telling me that it wants to read it in a different way. I'll give it here. Okay, so what I wanted to show you is this little. You see this little arrow here? We tend to ignore it. If I click on this, view analysis, this is actually writing code. So this is what I wanted to show you, is that one of the most incredible parts about GPT and all these large language models is that I call it democratizing code. So if you don't know how to write R or Python or any other language like myself, I don't know how to do those things, what's incredible is that you can program some pretty incredible things just with natural language. So we thought that the computer programmers were the last ones whose jobs were in danger. We thought that maybe, manufacturers' jobs were in danger, but actually the opposite is true. Programmers, and I wouldn't say their jobs are in danger. I actually think it can make them more effective and efficient. But maybe what you would have needed 10 programmers for to do prior, now you can do with 5, because really you get the initial, and this is very simple, but you could do very complex coding as well. But instead of having to understand exactly what's happening here, you can see the output. Now I've hit the free plan limit. You can see the output, and you can actually say, okay, actually that's good, but I need you to do the following. Okay, so that's just looking at it in GPT. Now let's go back to Julius. By the way, if you want to understand, there's nothing wrong with doing it in GPT. I find Julius's interface much easier to use and much more natural for me. It is a tool like other tools where you get a certain amount free, and then when you use too much, they say thank you so much, but now you need to start paying us. So let me show you how to use Julius, because I think it's really quite an incredible tool. So first of all is we already learned a few tools, a few coding languages. So you can see here, actually, you can choose whether you want it to run in Python, in R, which was mentioned, and in lean Python. So if I prefer using R, you can go ahead and do that within Julius. So it's not entirely different programming language. It's just using the artificial intelligence as a layer on top of the coding language. And there's two different ways for me to interact with Julius. The first way is through free text, okay? Exactly what we've been used to with GPT. I go in, I want it to do something, I can type in and say, please do the following activity, which is one way to do it, and we'll see how to do that. I'll show you how to do that in a minute. The second way to do it is actually there are pre-programmed workflows, okay? So if I want to clean my data, as was mentioned, or if I want to quickly visualize, or I can search for other workflows. So let's say I want to run a regression analysis. Okay, so I see here there's linear regression, multiple linear regression, okay? And when I open it up, so let's open up the multiple linear regression calculator, it actually shows me exactly what the workflow is, okay, that it's going to basically use in order to run this process, to run this workflow automatically. These are workflows that are either created, by the way, by the creators of the tool, or sometimes the users of the tool can actually create their own workflows. So essentially, we're kind of sharing as scientists different workflows and saying, I've already built this out, you can come and borrow it. I can get more details on that workflow, so I can see exactly what it's going to do. It'll tell me upload your data is step 1. Step 2 is going to be use the least squares method to perform a multiple linear regression and find the best line of fit for a set of paired data, generate the equation, a graph, and the prediction interval. So I know, even before I run it, I know exactly what the outputs are supposed to be. Okay? Now, if I want, another thing that I wanted to show you is, if you want, let's say you say, okay, you know what, this isn't interesting, let's do significance testing. Let's say, okay, it's an interesting workflow. I can look at the details of the workflow. I like it, but actually I want to run mine a little bit differently. So what you can do is you can actually go ahead and clone the workflow. Okay, so that's actually duplicating the workflow, and then I can go ahead and edit different sections of the workflow and say, okay, now I'm going to make it the Avi workflow. Okay, and I'm going to use this as a basis, what they've got here, but I might edit it and tweak it. Maybe I'll add a step, I'll take away a step. So you can actually customize it in a very impressive way so that it follows exactly the workflow that you usually choose. So there's a lot of customization abilities here. Okay, but let me actually work through here we go. We're gonna start not by choosing a preset workflow. We're gonna just kind of go with the flow. So I'm gonna go ahead and upload a file. This is the data set that I saw previously. Okay, and I'm gonna say, can you start by please telling me, identify, what? Okay, 1 second. All right, it's already jumping, it's already showing me a preview of the data set, please. So, okay, before we jump in here, I wanted to show you that actually it's already suggesting interesting questions based on the data set. I literally haven't typed in a single command yet, and I can say, you know, and it's suggesting to me questions that might be intriguing based on this data set. Sorry. So, let's see if I scroll over it. Well, let's go with it. Let's see here, what is the trend of poverty head count ratio? By the way, just to explain the data set that I chose, it's a data set which basically shows per country, different countries and their populations and how many people have make over the poverty line, which is $2.15 a day. Okay, that's essentially the data set here. Okay, it didn't want to behave. Let's see if I can choose a different question. If I can close this, I can actually see the question. Yeah, there we go. Okay,
Avi, can this tool guess whether the question is relevant to the data or not?
So essentially what it's doing here is it's saying, I've seen the data, I've uploaded the data, and now I'm saying, here are some interesting questions. Based on the data, here are some interesting, points that you might want to see. Now, most of us are not going to be researching in that way. Most of us are going to be starting with a research question, right? And then we upload the data. So what could be really helpful as a first step could be, instead of starting to, click on the questions that it suggests, although that might also be interesting, is you might want to first give it your research questions, right, and your hypothesis, and then say, now, well, there's a few things you could do at this point. The first thing you could do is say, can you find me those correlations, causations, right, based on the data set, or come to answer my question. You could also go ahead and say, based on the data set and the hypothesis, what tests would you suggest running in order to actually, find the end results? Now, what's important here, and I do want to show you some examples, but what's important here is to understand that with all AI tools, but especially with Julius, anything that's not totally clear in my instructions, it'll go off and do something not clear. So, for example, what Emily mentioned before about coding. If your data set is not clearly coded and it can't exactly understand, well, do you want me to work on tab 1, tab 2? Do you want me to work on, right, what's gender, what's age, what's population? If that's not super clear to the tool, it's going to start making mistakes. So make sure that if you have some sort of code key, or if you've got something, give that to the tool in the same way that you would give it to your colleague or your student or your friend. Okay, but let's try and go back and show you some examples. So please review the data set and tell me what the different tabs do. Okay, so I'm just starting with the very basic request that it learns the data set and it tells me. Okay, and I want to show you kind of how it works. It's gonna start throwing all sorts of stuff at you. Don't get overwhelmed. I'll explain to you exactly what it's doing behind the scenes so that you can understand. Okay, here we go. So let me break this down. Its response, we'll break it down into its different parts. First and foremost is what we're used to in ChatGPT. It's a chat. It's answered by question. I'll review the uploaded Excel file and tell you what different tabs contain. Let me examine the file structure first. Okay, it's then showing me the code that it used, that it ran in Python. Again, if we switched it up here to R, we could switch it to R, and then it would show me exactly what the code line is, that would, how it understood my command, my request, translated that into code, and then gave me an output in the code. Now, if you understand even basic coding, what you can do here is you can actually click on, but let's say you say, okay, this was good, but actually I meant it a little bit differently. You can then go in directly and edit the code. So now I can go in and I can revise, edit, delete, add new things. All right, and when I'm done, I can hit the save and run button, which is up here, and then it will rerun that step and any subsequent steps, any later steps, based on my revised code. So it's pretty, what I love about, and that's already, by the way, different than ChatGPT. In ChatGPT, you can't do that. So if it decided what code it wanted to write, it ran the command, you like it, it did it right, it did it right. If it didn't do it right, you can't. Here, I have full control. Again, it's creating that code for me, but if I want to edit and revise it, I can do it, I can rerun it. Okay, so that's the second part of its answer. First part of the answer is a verbal answer, second part of the answer is the code. And then the third part, which I really love, is code explanation. It's explaining, it's giving me a rationale, it's giving me an understanding of why did I run that code, what is it doing? Okay, so here it tells me the code imports necessary libraries, lists files in the current directory, and loads an Excel file to display its sheet names. So if I wanted it to do something else, right, I could go ahead and tell it. Okay. And finally, the fourth part of this answer that I'm getting is what we're trying to get to, which is actually understanding what the tabs are. So it tells me that the file contains 3 primary tabs. Data, which is likely the primary data set with main information, metadata of countries, and metadata of indicators. Okay, so I'm going to say, for now, let's focus on data. Can you present me the data? Oh, well, first, can you summarize that tab? Okay, just so we have a better understanding of exactly what's in this specific tab. Okay, we're going to let it run. Okay. So it's telling me, so interesting. So it's telling me that the top rows contain metadata like data source and last updated data. Row 2 is completely empty, so this might be a file that maybe I want to run through data cleaning, okay? Especially if I haven't cleaned it up yet, and that's, if you recall, the workflows. There's a data cleaning workflow, so it can actually help us with that as well. And data row 3 holds the actual headers, country name, country code, okay, etc. So, all right, that's what's in here. Okay, based on what you know, can you create any basic visualizations of the data set? Okay, and by the way, I'm probably not prompting this brilliantly, right? When you have an actual data set that you know what you want out of it, right? You'll be able to say, I want you to check, right? The correlation between, right, these different, the two different columns. So let's see here. Here we go. Okay, and here we have a distribution of poverty headcount ratio in 2010. Okay, now that might or might not be what I wanted, right? Again, I wasn't specific enough in my request, so I kind of just had to choose what exactly it is that I wanted. But the reason I wanted to show this to you is because I wanted you to be able to see for yourselves and experience the fact that you can actually go back and forth between the visuals and the text. So you can create visuals from text or from your data set. Or the opposite, if you have visuals, you can actually upload them and then turn them back into tables and Excel files. So that's very cool as well. Okay, now I'm going to ask what tests would you recommend running on this data set? And here we go. And it's getting very excited. It is recommended that on this, okay, so first of all, it gave me a distribution of poverty headcount in 2021. All right, maybe I wanted that, maybe I didn't. Like I said, it's a bit over-eager. Sometimes it gives me things I didn't ask for, but it got me to the recommended test. It said maybe I want to consider a time series analysis, comparative analysis using ANOVA, correlation analysis, regression analysis, right? And it's telling me why. And similar to ChatGPT, I can go ahead and say, okay, I'm interested in a regression. So let's do that. Sorry. Okay, so I'm telling it I want to run a regression analysis, and I'm asking it what the next steps would be. Okay, and it's going to outline an approach and then implement the approach of the regression analysis. Okay, and I think you're starting to get the idea of kind of how you would use Julius as part of your to do some of your data analysis. Again, it's running kind of it's not super different from the way that ChatGPT would go about it. But it's much easier and much more transparent in terms of the way you can use it. Here we go. Let's go back up. And you can see here I've already got my Model 4 summary. Okay, and it's already given me my output. All right. Two additional notes that I want to mention before I let you go and experiment. Number one, I've spoken to the founders of this tool. I know them. Good guys, also researchers. They told me that they hope within a year they've already made SPSS redundant. I don't know if that's going to happen or not. I'm not saying it's going to happen. I'm just telling you what their goals are. So that's an interesting, interesting thing. The second thing that I know everyone's very concerned about is privacy, right? We're always concerned about privacy, but especially when it comes to our data, that's like the heart of what we do. So I would suggest two things. First of all, it's good to know the founders are very aware of this. Your data sets your files are deleted after an hour. Okay, they store them for an hour and then they're gone. So it is important to sit and do your work in a session because that's kind of the trade-off. And the second thing is consider maybe you want to be using codes that the meaning of them, but if for whatever reason this got out, which again I trust the owners of this tool, they have good intentions, but I don't know if there was a leak or a hack or something happened. It wouldn't be that meaningful to somebody else, right? Because only you know exactly kind of what the significance or what you were actually studying, etc. So consider that as well. And like I always tell people, and I've had these conversations in the break a few times, we trust our data to all sorts of different companies, right? If you work with SPSS or you work with, R, they have access to that data. So don't ask yourself, well, is it riskier because it's AI? Look at the terms and conditions here, look at the terms and conditions there, and you can compare and contrast. Okay? I do want, because it's important, because this is a tool that kind of is very, I would call it sensitive, right? You have to be very specific with what you want and ask it in a very specific way and make sure you're going about it. I would love to give everyone now a few minutes to actually go and experiment yourselves. You can, if you want, you can sit next to the people that are next to you. If you anyway work together at the university. Again, if you have a data set, maybe from an old study that you've already published, you can play around with that. If you have a data set, if you don't, you can search for this poverty data set. I can again give you the name of that. It's called poverty headcount ratio. And start playing around. Ask it to do a t-test, ask it to do some regression analysis, and see kind of how it works. It does this, if you want to kind of master Julius, be ready to spend 5-10 hours, okay? It does, it's not terribly hard relative to the other tools that are out there, but there's a learning curve, so just be patient. I promise you that it can be extremely powerful if you use it the right way, okay? And of course, if anyone has questions, feel free to raise your hand and I'm happy to, yeah.
If I do it for this graph, you try to or Julius or anywhere in AI, and I want to copy and paste in the Word file. I always have a difficulty there, like to keep the same format when I do copy and pasting from ChatGPT or from anywhere else.
Okay.
Or if I make presentations, for instance, slides, I want to download, like I have, what is called? Another one, Claude. So I used once Claude to summarize checklists for the facility assessment and uploaded all the data and then asked to create the slides and then wanted to download the slides from Claude.
Yeah.
I could not.
Yeah, you weren't able to do it. Okay, so depends on the tool. First of all, here I see with the code, you can copy the code. So if you want to kind of take the code it creates and then put it back into R, you can do that. Let's just see here. This is giving me the text output of the data set. I was pretty sure that you could download the output. Let's see here. So if I scroll over here.
Like try to copy them. Like
Yeah.
and see how it will kind of
come out. Yeah.
Yeah.
I think it does a pretty good job. I don't know if there's Word on here, so I don't know if I can try and open it here. Let's just copy it in here. Yeah.
Yeah.
It's not.
This one is doing good job. ChatGPT sometimes does not feel it.
Right. Yeah. There's a lot of. I agree with you. I also run into issues sometimes when I'm going back and forth between programs. With ChatGPT, by the way, what you can do is you can say, oh, we ran out of the free plan here, but what I can do is I can actually, sometimes what I do is, if I asked it to create slides, you can actually say, now that you've created these slides, let's say for a PowerPoint presentation, please prepare a file, a PowerPoint file, a PPT file that I can download. And then it does a better job. So instead of trying to copy and paste it, ask GPT directly to create file types for you. It can.
Okay.
Okay? See if that works better.
Yeah.
Yeah.
I have a question about saving the code, because I think for me, in most cases, I want to have my code available for future use or to share with others. You said it deletes your whatever you've entered after some period of time?
I think it's just the files that it doesn't store anymore.
Okay, but does it save the code anywhere?
Yeah, I think so. If you go to, let's just double check here, documentation, no. 1 second. No, that's not what I want. Here, my threads. So if I go to my threads, it saved, meaning it saves your conversations, it saves your threads. I believe, by the way, that if you want to, with the paid version, it also, correct. So it's separate, I believe it distinguishes between the thread, which it saves, and the files, which it doesn't. The files, if I'm not mistaken, if you have all files deleted after 1 hour of inactivity. If you go for the paid version, there's still a promise of confidentiality, but I believe that you can store the files for a week. So it's so it's longer. I think it's just the trade-off of privacy versus and I think that's the decision they made. And also, as you see here, also your workflow. So we started working on a customized workflow for our process before, so that's also saved as a separate thing. So that's all saved for you as long as you need it. Okay. Yeah, I think it would be great if can maybe 10 minutes to. Do we have 10 minutes? No, I think it's supposed to be till 4. So if we. So what I would suggest, if it works, is maybe people will start working whenever they are finished. They can go out for coffee break, and then maybe we'll come back at like.
Yes, so be flexible, please. So we'll have, let's be back at 4:15.
4:15, okay. And if anyone has any questions in the meantime, feel free to raise your hand.
Yeah, so you can
answer.
Yeah, you can arrange your time so you can, or for 10, let's say. So well, let's be quicker. Grab your coffee or something, and then also continue to work. Survey development and question design, which will be led by Emily. Emily, please. Floor is yours.
Okay. Thank you for making it this far to the last session. I hope it's entertaining enough. Okay, so first I want to define what is a survey. It's a method of collecting data from a sample. Okay, and in order to collect that data, we use an instrument. And the instrument is used to collect specifically quantitative data. So when we're using a survey, we're getting quantitative, not qualitative data. And we might collect data on the distribution of health conditions, behaviors, use of services, programs, or monitoring and evaluation of programs, for example. So we use surveys in not only research, but also public health practice, industry, basically any sector. So some examples of how we might implement a survey is to collect data on the population burden of diabetes, or we might wish to estimate the impact of depression on health-seeking behavior. So in both of these examples, we can use surveys to collect that data. So some key features of surveys. They're systematic. So we do them the same way each time with each individual in our sample. Right. And we use structured questionnaires in order to do this. As I mentioned, the data that we collect are quantitative, which means that they can be counted or measured numerically. And we hope that the data that we've collected are representative of a target population. There are some caveats to this. For example, if you're doing maybe pilot testing of a survey, or you want to collect data on user satisfaction or something on an app, it might not matter if it's representative. But in most cases, we want our data to be representative so that we can use the data that we collect to understand some health condition or policy or something in a broader population. So some pros of surveys. They can be really cost effective depending on the method that you use. For example, online surveys are really easy to implement. They can be inexpensive. You can make one on SurveyMonkey in 20 minutes if you want and send it out. You can collect robust data on your population of interest over a relatively short period of time. They can provide anonymity. So, for example, with online surveys, individuals don't have to identify themselves. They're standardized. So this makes comparisons and data analysis easier. Okay, some cons. One is response bias, which I'll talk about some other biases later, but in short, it's when those who don't respond to your survey do so in a systematic way. There's some underlying characteristics that drive non-response. So for surveys that involve follow-up, they can be expensive and time-consuming. So, and involve large sample sizes. So even though a pro can be that they are done quickly and cheaply, in some cases they can be quite complex and expensive. Additionally, the data can be complicated to analyze depending on how we sample our population. So particular sampling methods require specific analysis techniques. Not in every case, but whenever you get to an analysis, if you're the one doing it, you should be aware that of the sampling method that was used. For example, like the big biobehavioral surveys, they're often doing specific types of sampling methods that you really have to account for in your analysis. And they don't allow for nuances that can be obtained through qualitative methods. So we saw that presentation on qualitative methods where you can really, dig into questions that you can't, with a survey. It's more surface level to some degree. Finally, there's no clinical validation, which I mean no testing, for example, to confirm diagnoses. But I will say that in-person surveys sometimes do have a biological component. So for example, biobehavioral surveys, you might collect blood tests, serum samples to do seroprevalence surveys or to do testing of infectious diseases. Okay, so we've defined what is a survey, why would we use it. How do surveys fit into the research process? And this is, I think, really important. So first, we're starting out with some research question, or if you're not doing research, if you're doing public health practice, or for government, analyzing some policy situation, you might just start with an objective or a goal, but you have some purpose that you want to conduct for your survey. So you should start with that. That research question will in turn drive the study design along with other considerations like monetary considerations, time, etc. But so you begin with your research question and your study design. These are going to dictate how your survey is designed and what variables you include in your survey. So when you are working on your survey, you should always have these in the back of your mind, especially the research question, because you want to make sure that you're collecting the correct data to answer that question. And that includes thinking about how you're, not only what variables you're including, but how you're measuring those variables in the survey. Then once we have written our survey, then if it's in, for example, in person or by phone survey, we need to train interviewers, sample participants, and collect our data, okay? Finally, after we collect our data, we can do our data analysis, interpret our findings, and disseminate our results. And what I want to mention here is that, again, so when we're designing our survey, not only to have the research question and study design in mind, but also, very importantly, have the data analysis in mind, because whoever is doing your data analysis will greatly appreciate if you've thought through how you're collecting the variables, and because how you do that will determine how clean their data set is and whether they're able to actually do the correct analysis to answer the research question. Okay, so what are some considerations for survey design? I again will mention survey objective and purpose. This goes back to research question. Additionally, what are you doing your survey for? Is it for research? Is it for program analysis, policy? Who is the end user of your survey results? So in other words, who is the target audience? Okay, so some examples here might be decision makers at organizations, policy makers, it could be other public health professionals, it could be the general public. Additionally, you need to consider resources, okay? Do you have what money, staff, time, facilities do you have available to conduct your survey? Because as I mentioned, it's going to be a lot more time-consuming and expensive to do an in-person follow-up survey than to do a cross-sectional online survey. Type of survey to use, and that's partly determined by resources. Again, this can be internet, mailing, phone, in-person. Regarding developing the survey, we need to think about the key variables that are necessary to collect to answer our research question or be used for whatever end goal we have for our survey. And how will we write the questions? Not just what variables do we need, but again, how will we write those? How are we collecting and measuring those variables? Because often there are multiple ways of asking a single question and measuring. I mean, even age, age, for example, you can ask it numerically. You could have age in categories already before you even get to the data analysis. So you should be thinking about this strategically at each point. Additionally, we should consider potential errors that might arise and potentially result in biased results. And I'll talk more about specific errors in a moment. Lastly, we should consider if we need to do any pilot testing. If so, the process is usually to do a pilot test and revise the survey, maybe test again. I've never been involved in any survey that does pilot testing, but so I'm actually not sure how commonly it's done, but it's something to keep in mind. Okay, I want to talk more about survey objective. This kind of, Verico touched on this earlier when she talked about different objectives for your research question. So again, it depends on your research question and your goal of your study. One objective might be exploratory. And honestly, in most cases, exploratory will be done with qualitative studies. We might have a descriptive goal where we just want to describe the health status of a population. So, for example, some of the big surveillance studies done in Europe and in the US are collecting data just to get prevalence data on various diseases like diabetes, cancer, etc. Explanatory. So this is when we want to actually look for causality, the effect of some exposure on an outcome, or the relationship between variables. And finally, we might have a predictive goal. So this is when we actually want to be able to use our data to develop some maybe a model that can then be used in another similar population to predict an outcome. Okay, so often like clinical testing, we might be doing like clinical tests to predict some outcome, or trying to do a predictive model that predicts whether somebody is likely to develop depression in the next year or something. So I have here this paper that I screenshotted. This is a really classic paper that we studied in my program in epidemiology. The Shimuli paper to explain or predict. And it's really good at explaining the difference between these two goals, because a lot of time you'll see researchers publishing papers and it's not clear. Were they trying to explain was that their end research goal, or were they trying to predict an outcome? Because these two goals are really different, explanatory and predictive, but you can kind of think about how they get mixed up. Predictive, for example, like you see papers where they're saying, we did a model to look at risk factors for some outcome, and then they just throw a bunch of risk factors into a model and look at the associations between those and the outcome. That's not really an explanatory model, and it's not really a predictive model. So I think you really need to understand the difference between these and what your goal is when not only you're designing the survey, but for all the steps in the research process. Okay, I just briefly want to go over samples and populations. Again, I know Verico talked about it, but I'll just go quickly through it. So our population is the entire group for which information is wanted. This is our target population. Our sample is the subset of the larger group, we hope, for which information is collected. And we use our sample to collect data, do our analysis, and then make inferences to this broader population. A sampling frame is then a list of all the individuals in the target population from which the sample is to be drawn. So for example, registries are sampling frames. So a list of registered voters, a customer database, a registry of
How can you calculate the samples from
the list? So you get the list, and then you apply whatever sampling method you're going to use. So it might be simple random sampling, where you just, use like a random number generator and rank the people in it based on the number you generate and pull the top, 500 or something. Or it might be more complicated. You could use respondent-driven sampling or like snowball sampling, whatever more complex methods. Does that answer your question? So yeah, basically we have our list, some list. That lists the people in the target population, and then we sample some way off that list. So that's what a sampling frame is. Okay. So why does this matter for survey design? This determines how many respondents will take your survey. It should determine how the questions are worded for your study population. And if sampling is not done adequately, then your survey results might not be valid or reliable. So you can get biased results. Even if your survey is written well, if you sample inadequately, you still might get biased results. Okay, so again, Jericho also mentioned study design. I'm just going to talk about it in two ways here that are relevant for survey implementation. So for cross-sectional surveys, we're just going to do a survey conducted at a single time point. This is often used for prevalence data. We might collect data on risk factors for some outcome, knowledge and behavior. And longitudinal studies are when we conduct the survey at multiple time points. So this is typically used for incidence data. So when we want to collect data on number of new cases over time of some disease or health outcome. And longitudinal data is particularly useful for evaluating causality. So if you want to evaluate, does some exposure cause some outcome? Okay, so like does eating a Mediterranean diet result in fewer cases of diabetes or something like that? Or does smoking cause lung cancer? Which we all know it does at this point, but the exposure of smoking and the outcome is lung cancer. So in the case of longitudinal surveys, we have a baseline survey typically, and then follow-up surveys, okay? And the follow-up surveys may or may not evaluate the same variables that you collected in baseline. It depends on your research question. You might add some variables, in different follow-up visits, or take some away if you decided they aren't relevant. Okay, survey errors. So I'm going to talk about 4. I'll just get right to it. So the first is coverage bias. So coverage bias is when your sampling frame is not representative of the target population. So in this case, you might be missing some of the members of your target population that are not, for some reason, in your sampling frame. So for example, I say you have a list of emails and you're trying to sample all adults in some population, and you sample from the email list. Well, you might miss some older adults who don't use emails. So what do we do for this? Blocked out here, but so in this case, so we may need to sample from multiple sources to address this bias. So in my example of the missing older adults who don't have emails, one way to address this would be to have both mail-in and survey options, or to use addresses and emails for selecting participants. Okay, sampling bias. It's similar, but a little bit different. This is when your sample is not representative of the target population. So with coverage bias, we're talking about the the whatever we use, the list we use, our sampling frame, to sample participants. Sampling bias, we're talking about now already who we have in our sample, okay? So in this case, if our sample is not representative of our target population, we can't generalize the results to that target population. This can happen by chance, unfortunately, or it can be due to your sampling scheme. For example, if you do like convenient sampling, again, say we wanted to sample young adults in Georgia, and we go to Galleria and just ask people to take our survey. It's not systematic at all. It's likely that we won't get a representative sample of all young adults in Georgia. And this can be addressed by using a systematic sampling method. So I've listed simple random sampling because that's a great one. It's very straightforward, and there are more complex sampling methods as well. Okay, non-response bias. I mentioned this earlier. This occurs when there are differences, systematic differences between those people who responded to your surveys and those who did not. So for example, imagine you're doing a survey to assess injection drug use among people who inject drugs. But what happens is that those who are on drug treatment responded at a much higher rate than those who were not on drug treatment. Okay, so you have, based on this characteristic of drug treatment, a systematic difference in response to your survey. Okay, so now you no longer have, you have missing data. You essentially no longer have a representative sample, and that's the case. So just to describe what our response rates, they're the proportion of sampled individuals who completed your survey. This can mean not completing any questions. It can mean starting the survey and stopping partway through. And it can mean skipping certain questions. So in all of these cases, you may end up with non-response bias and missing data. So a properly sampled study population can still result in erroneous biased results because of poor response rates. Okay, so what are some factors that affect response rates that we can keep in mind when we're sampling and conducting our survey? First is the length of the survey. So if the survey is too long, participants may burn out. This is particularly a problem if there's not an interviewer involved, because if there's an interviewer there, they can hopefully kind of prompt the participant along. But for example, if you have a really long internet survey, I'm sure we've all taken surveys that were like, when is this going to end? So, or maybe you drop out halfway through because it's just too long and taking too much time. Questions should be concise, not overly wordy. And the language used in the survey should be geared towards your population of interest. So, for example, you shouldn't use jargon, and you should make sure, if you're, for example, in a really obvious example, if you're doing a survey with children, it should be written at whatever grade reading level they are. The method of the survey can also affect response rates. So, again, online, well, it might be easier to respond online than having to go in. It's more likely that people might drop out or skip questions, whereas in person you can prompt, same with on the phone. If there's an interviewer involved, they can prompt and hopefully get participants to finish the survey and also respond to questions that they might have otherwise skipped if it had been another format. Also, we can provide incentives to for participation. This is, you have to consider the ethics behind this. There's lots of literature on this, and we talk about this in most educational programs, but you can provide gift cards that are appropriate, that they incentivize but not coerce, basically. Also, trust in the interviewer. So this highlights the importance of training. and the relevance of the survey topic to the respondent. So for example, going back to my injection drug use example, if we sample individuals who are who do not engage in injection drug use, they're not going to have an incentive to participate in the survey. Okay, last I'm going to talk about measurement error. So this is when there's a systematic difference between what we measure in the survey and the true value. And this is often due to poorly designed surveys. Okay, so the questions aren't written well. This can be because maybe your response options, so the options you have for the question are not clear. Maybe the question isn't clear. Maybe you have a bad data collection method. In any event, what happens is that you basically have measured whatever you're trying to measure incorrectly. So we can often address this through a formal assessment of reliability and validity, which I'll talk about in a minute. Additionally, there's specific bias analysis techniques that we can sometimes employ in the data analysis stage to try and correct for some of these biases, including measurement error. Okay, so validity and reliability. What are these? Validity is that the items that you measure, the key variables that you're trying to measure in your survey are actually measuring what they intend to. So if I want to measure height, hopefully asking the participant's height is actually getting a valid measure of height. Reliability means that the data are collected in a reproducible way. So if we repeat the survey on a similar sample, we should get similar results. And there are specific tests available for this, for reliability. I'll talk a little bit more about validity, but I haven't. No, I didn't list the tests here, but yeah, there are a bunch of tests, and I can add this in if anyone's interested to the slides before we send them out. Okay, validity. So there are 4 general types of validity which we might be interested in. First is face validity. This is, do the questions make sense to non-experts? Okay, so we ask non-experts, are these questions measuring what they're supposed to measure? Content, this is the same as face validity, but now we're asking this question to experts. Okay? These 2 types of validity are considered qualitative assessments of validity. Next is criterion validity. So with this, we compare our instrument with another one that's already validated, and we do this on our same respondents to see if we're getting valid results. And lastly is construct validity. So in this case, we're comparing our instrument with the theoretical concepts that are supposed to be represented in our survey. And these last 2, criterion and construct, are considered quantitative assessments of validity. Okay? Okay, so there's a lot of considerations for survey design. The research question, how it's going to be used in data analysis, potential bias, well, how you sample, potential biases that can arise, and this validity and reliability. Okay? So now let's talk about actually writing the survey. So the first thing we typically want to do is define domains. So these are the broader categories of variables that we want to collect. Next, we want to write items, or these are questions, we call them items, and the responses options to those questions. Then we need to assemble the survey once we have our domains and our questions. What does this mean? It means what order of do we want our items to be in? How should the layout of the survey be? This is particularly, so if there's an interviewer involved, the layout should be useful for the interviewer. If it's an online survey, the layout is really important to prevent non-response bias. We want to make sure that It's easy and nice layout for respondents. We also need to consider logic, namely skip patterns. I'll talk about that in a minute, and instructions as well. And we also need to consider documentation at this point. So specifically variable names and response coding. Okay, so this is what you're going to end up with in your data set are the variable names and the whatever responses for each observation there are. So technically this is where your data dictionary should come from, which I talked about earlier, but as I mentioned, sometimes we don't get a data dictionary at this point. Out there I mentioned data dictionary. Okay. Okay. So survey domains. This is these are the biggest categories within your survey. These are the major topics that you want to cover. So, for example, we might include demographic-related questions. I assume in almost every survey we're doing demographic-related questions. We might want to do questions on substance use and then sexual behavior. So these are all the big, broad categories of questions. We should, or in most cases, include multiple questions in each domain. For example, within substance use, we might ask about the frequency of drug use, types of drugs used, age at first drug use, etc. So at this stage, we can create an outline of domains and the questions that we think would be relevant for each of those domains. Okay, next, when we're doing question writing, there's a number of things to keep in mind. These should be written in complete sentences. They should be specific as possible. Each question should cover only a single idea. So if you want to ask, like for example, about how many days somebody drank alcohol in the last week, and then also how much they drank, those should be asked in separate questions, not in a single question. You should use simple language. Again, this should be driven by your sample population, the level, the reading level, and the types of words used. You should define any unusual words, acronyms, or specific measures. You should specify relevant time periods, and you shouldn't make the time periods so long that it's hard for the participant to recall. So I just gave an example of drinking alcohol. So you wouldn't want to ask, how many days did you drink alcohol in the past year? All right, that would be crazy to ask someone to try to recall that. So the relevant time period here might be a week. How many days did you drink alcohol in the past week? You should define any concepts and measurements, as I mentioned above. So for example, maybe instead of asking for a numeric response with this question about alcohol, we have options like most days, some days, in which case we need to define what is most days, what is some days. Okay. Things to avoid with question writing. You should not use double negatives or not. So what do I mean by this? Here's an example. How many times did you not go to the gym in the past week? So instead it should say, how many times did you go to the gym in the past week? We should avoid leading questions. So an example of a leading question is, you probably would like free health care. How much would you like it on a scale of 1 to 10? So can you see why that's leading? Because we're saying, we're pushing on them, you would like free health care. Tell me how much you would like it. So you don't want to lead the respondent to a response. You want them to answer by themselves without any pressure from you. Okay, response writing. So again, the responses, these are the options that are available for.
Before we move to this response writing, I have a question to clarify the scaling questions. To clarify the scaling questions, like from 1 to 10, for example. We may need to mention here to give the clarification, right? What is 1 and what is 10?
Yes, absolutely, yeah. So if we're saying something like, rate this on a scale of 1 to 10, 1 being never, 10 being always, or something, yeah. Exactly, yeah.
Sometimes also we find difficult to answer the question based on our experience, and we may have just the option not applicable or something. When we have
yes.
Yeah, so to include this kind of...
Yes, absolutely. There should always be an option of I don't know or chose not to respond.
And sorry to interrupt, but let's clarify all the related questions to that issue. For example, if you mention not applicable and not no, both of them can exist independently, right? So someone may not know but it does not mean that it's not applicable, right? But should we mention both of them, or not know sometimes can also, it may mean also not applicable, or it's a bit confusing.
Yeah, I think typically, as I've seen it, we usually just have don't know, or we usually have two options, don't know or not applicable. But I don't think it's too much of an issue which they choose, to be honest, because in the data analysis, those options are going to get coded as missing data. So they're going to be treated the same way in the analysis in most cases. So I think it's not too much of an issue if you have both options. I don't know if anybody else has any comments on that in their experience working with surveys. No? Okay. Yeah. But it's a good question. Okay, so response writing. Again, the options should be simple, clear, and no jargon. Our response options should be mutually exclusive. What I mean is that the options don't overlap. I'll give you an example in a minute. They should also be exhaustive, meaning we're not missing any categories, so all options are available. And you shouldn't have too many or too few options. And also, as Eka just pointed out, we also need to consider our choose not to respond or not applicable or missing. And what, I guess, which categories you include also should be driven by what your research question is and what the question is asking, if it makes sense because, for example, if you ask someone's age, well, they could not know it, I guess. So actually, that's not a good example. But maybe gender. You'd assume that somebody, well, they might not know that either. But yeah, but we do need to consider how we're going to collect what will be a missing data at a later point.
Yeah, so an example here can be, for example, if we are asking a specialist the question about the management level issue, they may not know because they are not managers.
Yeah.
But it does not mean that. They also may mention not applicable.
Yeah.
So it's sometimes confusing.
Yeah, because because it could be, they could say I don't know in that case, or not applicable, or they could just say choose not to respond. And so I'm not sure. No, that's a good question about best practices of writing that. And you know what I'll do? I'm going to look into it and add some stuff to the slides, and we can include that. Now I'm thinking about this too. Okay. Okay, so mutually exclusive. Okay, so imagine you have this question: how much is your annual disposable income? And these are your options: 0 to 30,000, 30,000 to 60,000, 60,000 to 90,000, 90,000 or more. Can anyone see what the problem is with the way this question is written?
Overlapping. Yes.
Exactly, yeah. So if I say 30,000, am I in this category or this category? It's not clear. So in this case, we really have a measurement error problem, and we're likely to have to potentially get rid of this data altogether in our analysis. Okay. Okay, so exhaustive. How many sodas do you drink per week on average? 1 to 2, 3 to 5, 6 or more. What's the problem with this? Yeah, exactly. We're missing those who don't drink sodas. We're missing a category. Okay. So again, we'll have missing data here. Okay. So response types. There's lots. These are kind of in order of how often they're used. So these select one options are the most common, followed by select all that apply and numeric. We might also have ranking, where we have to say, rank from your favorite to your least favorite. And free text is last. So going to the select one option, we might have yes, just a yes/no question. Do you drink coffee? Yes, no. I should have added here, and I'm sorry I didn't, the options for the not applicable or don't know. An example of multiple options would be, in the past week, how often did you go to the gym? Never, 1 to 2 days, 3 to 4 days, 4 to 6 days, or every day. You might also have scales. I'll show you these on the next slide. And here's an example of a select all that apply. Have you tried any of the following exercises? Select all that apply. So you can select, say you've done yoga, Pilates, and weightlifting. You would select all of those. Okay. All right, so scales. Or particularly, I'm mentioning here Likert scales. These are ordered responses. They often include 5 or 7.
It belongs to the quantitative methods, yeah? The Likert scale.
Yes, yes. Because how they're treated in the analysis is these are categorical variables, ordered categorical variables. So for example, you could do, if this was your outcome, you could do an ordinal logistic regression model. Or you might want to look at, like, does age differ, like how somebody agrees or disagrees, does it differ by age? So they typically include 5 to 7 options. Here are some examples that I'm sure you've seen these before. Strongly disagree, somewhat disagree, neutral, somewhat agree, strongly agree, always, most of the time, sometimes, almost never, or never. One thing I want to note is there's a lot of controversy around whether you should include neutral options or not, just so you're aware of it. I don't think it's been decided one way or the other, if it's a good thing or a bad thing, so just know that there's differing opinions on that. Okay, so in addition to just writing the questions and the response options, you also want to consider the order that you're including these questions in your survey. So the suggestion is to go from the least sensitive but still very important questions to then go to the main study aim questions, and then to end on what are the most sensitive questions but maybe less important. So here's an example. Say our study question was related, again, going back to injection drug use. So we might start with the demographics, then go to the substance use related questions, and then we might end on other stigmatized behaviors, or for example, sexual behaviors, okay? Because those are secondary questions, but they still might be more sensitive. Okay, I mentioned logic. One of the most important ones is skip patterns. So this refers to skipping some questions if they're not relevant for a particular participant, okay? So for example, say we're collecting data on just the overall health of a population. Part of it includes asking reproductive and pregnancy related questions. We're not gonna ask those to somebody that reports as a male. Okay, so they're gonna totally skip all of those questions. And what happens is when you get your data set, it's missing, but missing for the correct reason of that it's due to a skip pattern. So for paper surveys, we should include instructions to say something like, if no, proceed to question 8, or if male, proceed to question 8. With electronic surveys, you can automatically skip questions based on responses, so it can be built into the programming. Okay. I've included the survey checklist. I'm not going to go through it, but I thought it was handy to have. So you can keep this on hand if you find it useful. Okay, how am I doing on time, Eka? Okay. So just briefly, I'll go through the pros and cons of each of the types of surveys. So in-person surveys. The biggest pro of these is the higher response rate. And it's possible to document the demographics of non-responders. So if somebody doesn't want to respond to a question, we have a lot of other data on that person that we can have documented to see if there's systematic differences in those who are responding or not responding to a particular question. These surveys can be longer or more complex, and the interviewer is available to prompt and clarify questions. Cons, these are more expensive. They involve training, staff, transportation costs, time. And there's this risk for social desirability bias anytime you have an interviewer. And actually, I don't know if Avi will mention this, but I was thinking something that was mentioned the other day about having bots do the interviewing, because they still might be able to do, document non-responders and clarify questions, but there might reduce social desirability bias, which is where a respondent answers a question in a way that they think is socially desirable instead of answering the truth. So it's a problem for more sensitive questions. Okay, telephone. Again, because it involves an interviewer, we have a potential for a higher response rate. And again, it's possible to document the demographics of non-responders. And the benefit of this is it's cheaper than in person. And it's useful for short surveys. However, it can be difficult to ask more complex questions over the phone. There's a potential for technical issues, right, if we lose service. And it can be hard to determine what your sampling frame is actually here. So, for example, if we only have cell phones, what if we want to do a survey of, I'm sorry, I'm going to use a US example because it's what I have in my mind. If we want to do a survey among individuals in California, and back in the day, we could use a phone book and go off people who have area codes in California. But now that people are using cell phones, I might live in Iowa but have a California number, or for some reason. So it makes it a lot harder to just sample off of cell phone numbers to get the population of interest. Okay, mail-in surveys. There's less concern here of social desirability bias. These are cheaper compared to in-person and phone. Non-response, however, can be quite high. This goes for email as well. There are self-selection issues. Those people who choose to take the survey might be particularly highly motivated. You see this, it's like the people who respond to like political Instagram posts are the ones who either are really in support of the post or really against it. You don't really get a lot of the middle ground. Internet surveys. These are the least expensive method. They're really easy to complete. They minimize social desirability bias. And they're great for reducing data entry errors. So because the data should be automatically uploaded into your data management software, and basically it's already in a really great format. And it doesn't have the issue where interviewers sometimes can, humans can make errors, but if you're doing it on the internet, you don't have the issue of the interviewer having to listen and record and potentially record incorrectly. Again, you have non-response and self-selection issues. And this requires technological expertise. So for designing and conducting these surveys, you need to be able to create the online survey, have it interface with your data management software. But I think they're pretty straightforward. There's a lot of tools available, so they're not necessarily prohibitive if you don't have a lot of technical expertise going into it. I'm not sure that they're that complicated to pick up. There's also the potential for data breaches and other issues related to data security with this. Finally, depending on your population of interest, some individuals might not have reliable access to internet, so you might be missing, you might have that coverage bias where you're missing some individuals because they don't have internet, so they're not able to even get the survey. Okay, I just wanted to briefly mention, make a note on data management and analysis because it's tied into survey design. So the survey designer really ultimately determines how clean the data is when it's ready for analysis. So if you're the one who's developing the survey or working on the survey, please have the data analyst in mind because so many of the issues that we see when we get a data set could have been resolved at the survey design stage. So we should ensure data quality, that it's timely, that it's complete, and that it has minimal errors. There are a lot of data management tools that can aid in collecting clean data and managing your data. I'll mention a couple. And we can actually create surveys directly in our data management software and even conduct them through the software, and the data will automatically be there. So it really reduces potentials for error. So here's some free data management tools. Kobo Toolbox and Get ODK, I think they're quite similar, but all of these actually you can write your survey in them, push it out through these services, and the data will automatically get uploaded, and you can manage it here. RedCap actually offers a free option. It is a licensed option though, so you have to use it through an organization. So you can have your organization request the license, and it's free. Yeah, okay, that's it. I also didn't mention anything about using tablets, but in-person surveys can also be linked up with tablets. So in that way, it's similar to an online survey where it reduces potential errors from the interviewer's side, and it can also be used with these tools as well.
Like you say, oh, I should have the scale here, or oh, I should have like more options, and that's really pain. Particularly when you go to the not only descriptive but analytic and writing the paper. It's always particularly when you go to the writing the paper, because you have to compare your results with the international findings, and here you are really having tough, and you are not really looking at the international like published papers while developing the questionnaire. And I'm learning of this painful experience. If I plan to do the publication, I have like the study, I really plan to make a scientific paper. I also look the scientific papers on this topic, not only for just looking the questions, what they asked and what variables they had, but also how they asked. So keeping in mind that at some point I will have to compare my findings to international data, so it's also helpful. So in my case, but it's you never protect it. You could still miss it, and have not right question for your population. Thanks.
Thank you so much, Marina. Would you like to comment on that?
Yeah, I mean, it's hard to foresee what the issues are going to be. That's you're not a fortune teller, unfortunately, but
I guess that's one benefit of pilot testing. Unfortunately, I know that's not always a possibility as well because of time and money, but ultimately I think that's the best way to potentially address those issues if you can pilot test and see what questions don't work, what you have to drop or change, and how that would affect your research question and methodology.
And I have one more question regarding validation of questions. So, for example, you use one type of question, for example, the positive aspect, and then you validate this issue by negative question, right? So, do you see that it can be a bit risky for the data analysis? So, for example, you are asking that, okay, have you seen these kind of challenges there, and then you are asking that you have not seen this. I mean, that's the absolutely opposite questions, because sometimes people not to do these things inertially, you know, so to realize things you are investigating. But sometimes it can be confusing because still you can get the answers quite confusing, because they are again, despite the fact that it's the validation questions, they go and answer that in a wrong way. So can you say anything on that, how to avoid this?
So to clarify, do you mean, so are you saying that in the survey you asked a question using the positive, and then later you ask it in the negative, and now in your analysis you compare it and they're giving contradictory results?
Mm-hmm.
Yeah, I mean, I think that could be a problem for your analysis. In that case, I'd probably go to the literature and see what has been similarly found, or if how people analyze data like that in other studies, because otherwise, yeah, I would wonder whether that question just is probably not valid, would be my first inclination, and wouldn't be useful for the analysis. Does that answer your question? Yeah. Sometimes there are bias analyses that can be done, but I think if you've actually done it, if the question, if you've included those two questions and they invalidate one another, I'd be hesitant to use it for an analysis. But it could be something you still report on, and you say, well, maybe it's just, well, I don't know. I think maybe I would, again, go to the literature and see what similarly people had answered in other surveys, to see why, to try and get at why there might have been contradictory results. Is it because of how you wrote it? Is it because, yeah, is it because it's, well, I guess it would probably be because I can't think of other reasons why you might get contradictory results besides writing the question in a way that's not understandable. But yeah, I'd be hesitant to use it for an analysis, I think.
And one last question for me, because I came across this kind of problems, and let's clarify, because people may also have these difficulties. For example, you have 5 possible answers in the question, and then you did the survey, and then you identified that two of them may not make sense because of a big difference in answers, or many different reasons, right? Is it possible in the end of the survey process to merge the questions and then reframe the questionnaire or the results?
Yes, I do. We do that all the time in data analysis. If you have few observations in some categories, yeah, you because otherwise you can't usually do, or it invalidates a lot of statistical tests and analyses having sparse data. So yeah, all the time. That's not a problem. Yeah.
Thank you. Thank you.
I have one question. I just want from your side confirmation if I got it right or wrong. You mentioned surveys shared on the internet. I just wonder, do you mean, for example, if I share my survey on LinkedIn and just, because then my question is, because on LinkedIn we have a part of the population who is actively engaged with the work environment. I mean, it's a specific part of the population, not so wide. You can just say that it's the right representative of the whole population. I mean, what can be the solving of this problem, for example, using other social medias or?
I think it's common to use other social medias, to use multiple websites to push ads for your survey, if that's what you're using, like banner ads or. So definitely that's one way to address it. Similarly to using email or using mail and email, you just find multiple ways to get the survey out to your population.
Thank you. Now we will start with SurveyMonkey, I guess, right?
Yeah. Okay, so we're in the home stretch. 2 more tools, and then that brings us to a close. The first one that I want to show you is SurveyMonkey, which you may already be familiar with. You're probably already familiar with. It's a classic survey collection tool. I imagine that SurveyMonkey is not the only tool that has these functionalities, but it's the tool that I'm familiar with and that I use. So I just want to show you when you first start to create a new survey, you're given a few options. So you can just start from scratch with some totally blank, and you can make your own. There are templates. So you can see, this is probably based on my profile, right? A course evaluation template or a voting template. But what I want to show you today, it's going to be annoying. Okay, what I want to show you today is how we can build a survey with artificial intelligence. Again, keep in mind that you're going to want to review the questions carefully, you're going to want to check them, validate them, and make sure they're good. But I find that in general, they at least follow kind of the best practices in terms of question writing to a great extent. So it's a really great way of just getting kind of a basic beta version that you can then go and discuss. Okay, so basically it works just like every other tool that we've used, in that we have to start with a prompt. Okay, so here we go. It gives us sample prompts, so I can use one of these prompts if I so choose. I actually don't want to do that. Here we go. Okay. So what do we want to learn? Okay. I want to create a survey of participants at our AI training for healthcare professionals, especially researchers, to understand what they did and didn't like about the training, how it can be improved, and what to learn for next time. Okay, this is more of kind of a professional survey than it is an academic one, but you could do the same thing for academics. And here we go. It's going off, and it is coming up with survey questions. And here we go. Okay. And like you see here, right, you've got a Likert scale, different questions with different answer types. How would you rate the overall quality of the AI training? Which aspects of the AI training did you find the most valuable? Lectures, hands-on sessions, case studies. Okay. Which aspects of the AI training did you find least valuable? Which topics would you like to see covered in future AI training? So you can see here it's you know, what I would expect at least from, you know, from a typical survey, how likely you to recommend this to a colleague, okay, and it's got all of this information. Now let's say I say, okay, overall this is good, but I would like to be able to review and revise. I simply click on the continue button, and now I actually am in the design survey, okay, and all of these fields are editable, so I can decide, you know what, I want to change the survey title. Well, let's go to the second question here. Okay, I can edit it, and I can decide which kind. So currently it's checkboxes, but I can decide actually, you know what, I don't want checkboxes. I want it to become a multiple choice answer so that they can actually choose more than one. So I can go ahead and do that. Here it gives me a drop down where I can actually, it gives me the Likert scale of the different kinds of answers I can get. So agree, disagree, satisfied, not satisfied. So if I change, let me just go here and move back to checkboxes. And right now it, oh yeah, let's see. Okay, and I've now changed it to a scale of strongly approve, approve, neither approve nor disapprove, disapprove, and strongly disapprove. Right now it's currently 5 items. I believe I can turn it to 7 items, and now it adjusts the text appropriately so that I can, you know, so that it's easy for me to do, and I can at any point go ahead and delete one of those or edit any of those answers. I can also go ahead and reverse the answer order. So if I want to, you know, randomize it to make sure that people aren't just, you know, checking the first one over and over, I can go ahead and do that. Yeah, so it's pretty. I don't want to do a whole, you know, tutorial on SurveyMonkey right now, but I think it's definitely, you know, worth, if you are putting together a survey, it's definitely a really good tool to be able to both create the original survey questions, of course, with your review and your reflection, and then also to be able to go ahead and edit those appropriately. There was one more thing I wanted to show you. Yes. Okay. There's all sorts of advanced logic that you can do. So you can say, if the answer to this question, I don't know, let's say, you know, it's a medical questionnaire, and you're asking, you know, have you had, you know, this disease before? And then the follow-up questions are, if the answer is yes to the previous question, then, you know, what have your symptoms been? When's the last time you had this reaction? So what you can do in SurveyMonkey is actually create what's called conditional logic. So that means you can say, you know what, if they answered yes to this question, or if they answered excellent to this question, then you can skip to, you know, 2 more questions. You can skip down the line so that they don't have to answer every single question. So that way it's kind of a more engaging, interactive, and actually is easier for the participant to fill out. I'm sure we've all been in the doctor's office where we have to write, you know, no, all those, you know, when we're doing medical forms. So it's just an easier way to kind of make that easier for the user. And where that is really important is the number of full responses that we get. You know, as Emily said, we can oftentimes be in a situation where we don't get complete, especially if our survey is a bit longer, we don't get complete answers, so that's a situation that we want to kind of avoid. You can see here also a preview of the survey, what the survey is going to actually look like when people fill it out. Pretty simple, straightforward, clean, nice, and then all of your answers, I'll show you, all of the data will be found here in the collect responses. Okay, I don't currently have any data because no one actually filled it out, so this should be empty for now, but when you actually start getting data in, you'll be able to see that data, you can download it, you can manipulate it in different ways. And I believe, yeah, so they also, you also can pay for them to target your ideal respondents. So you can actually go in here and say, yeah, I want to find, here, let's have a look. Okay, let's say all the questions need to be required. Oh, sorry, here we go. Okay, and I can decide here, obviously it's not necessarily cheap, but I can decide here, general population, medium sample, large sample, full-time employees, consumer shoppers, parents, right? All sorts of different, you can track here how many respondents you need. Again, I'm not going to spend too much time on this because I imagine that most of you want to do your own data collection, but it's cool to know that this is possible. You can target down by country, by gender, age range, income, etc. So it's a really great way of being able, if you maybe for your company, if you do want to get a quick survey, a large survey done quickly and you don't have the in-house capacity, definitely a possibility to use this as an option. Okay, so that is SurveyMonkey. Again, highly recommend checking it out. I imagine that other survey tools also have AI tools, so be on the lookout for that if you have a subscription to a different tool, but it can definitely be very helpful. Okay, so that is surveys. One more tool, last tool. I saved my favorite tool for the very end, so that we make it through the day. The last tool that I want to show you today is a tool for research communication, or for really any communication. Raise your hand if you have to put together slides for a PowerPoint at any point in your... All right, yes, we know the people who have... All right, that's probably everybody. I know I put together PowerPoints probably at least once every 2 weeks. It takes me a long time, it's tedious. Not necessarily I know what I want to say, but just putting together the graphics in a way which is as clean and clear. You may have noticed that I have been, the slides that I presented specifically on the first day were created by a tool called Gamma. Gamma is my favorite AI tool, I have to say, because I think it kind of brings together the best of AI all into one tool. I wouldn't say, it's not perfect, just like every other AI tool, but I really enjoy using it. So let me show you exactly how it works. Go into Gamma, create a profile, as we're used to, and then there are 3 ways to what I would call jumpstart your slides. The first way is if I have text already from an existing presentation, or I don't know, I have something typed up, I can go ahead and type up an outline or a full text. I can just copy and paste it. That's option number 1. Option number 2 is if I have a file or if I have a URL, I can just feed that in, okay, and that will be the source of my presentation, of my PowerPoint slides. So think about if you want to take something from a website, or if you have some sort of academic article even that you want to turn into a presentation, you can go ahead and do that. What I'm going to do today, though, is I'm going to show you how to use generate, and as we're already familiar with, it starts with a prompt. We have to start with a prompt and tell it exactly what we want it to generate. So here's what we're going to do. Okay, make us a, well, we're asking for a presentation summarizing 3 incredible days in Tbilisi where healthcare professionals came together to learn research methods and AI tools for research. Okay, so this will be our summary slides presentation. You're welcome to use this, Eka, if it turns out okay when sending out the summary. And actually what I like is the first thing that it does before it starts running and jumping and making the design slides is it actually gives me an outline. Its suggested outline for what should be in these slides. Again, if I would have put in text already, it would have used that text at least as the basis.
Can you put the book here or some materials?
Yeah, so here, I'll show you again. When you first, sorry, maybe I'm going a bit fast. When you first create a new one, there's 3 options. You can generate from scratch, you can paste in text, or you can upload a file. So really any way you want to put it in, you can put it in and it's good to go. I'm showing you how to generate from a prompt, but you don't need to generate from a prompt. You can create from the existing text. The only thing you can't do all that well is save design features. So if you have something that has your logo in exactly the right way, or there's certain colors that you need to use, that Gamma isn't great with. Okay, so just keep that in mind. Let's take a look at the outline that it suggested for me. So, I mean, I probably should put in here the agenda that we did. Yeah, well, we could do that. We could try that. Let's try that. We want to actually make it good. We don't want to just do something that's not so good. So let's take the agenda. Okay, and we'll see if we can upload it. We'll see if we can give it as a Google Doc. So let's go back for a minute. Oh no, we can go here. All right, and again, we want to import from a URL. I'm hoping that they can read the Google Doc. Let's see. Okay, I think it needs sign in with Google. Let's see. Okay, no, yeah, it needs access. Okay, we'll go back to our original way, but if you hook it up with your Google Docs, and then it'll be able to read the Google Doc. Here, day 1, foundations of research methodology. Day 2, diving into AI for healthcare research. This is not our itinerary, but it's what they're pretending our itinerary is. Day 3, practical applications and project development. Now I can slide any of these slides up and down, so if I want to make something earlier or later, that's fine. I can also go in and edit any of this. So for example, I don't want example proposal, and I can delete that and go ahead and do that. So, but let's assume that the text here is what I want, okay? Then all I do now is, my Zoom is getting in the way, so let's move that out. Okay, I go ahead and click on generate. By the way, you get free, I think it makes up to 8 slides. So just be aware of that, it's not endless. And even those 8 slides, I think you'll be able to get like 10 presentations out of it, but it's not endless, okay? And eventually it'll say, all right, now start paying us. But here we go. Okay, and now, all right, ignore that. Okay, now in about, how many seconds was that? 3 seconds, 10, 5 seconds? We were able to get an entirely designed PowerPoint presentation summarizing. Sorry, is this actually a picture of Tbilisi? Okay, wonderful, that's great. It's probably, most of the photos that is AI generated, so it could be this is what it thinks Tbilisi looks like. Whether or not it's an accurate photo or not, I don't know. Okay. And it's got here foundations of research methodology. It's got here a nice, these nice round tables. Okay, it at least it isn't watching us, so that's good, right? It doesn't know that we're all sitting in an auditorium, not at round tables. AI in medicine, hands-on AI training, NLP for healthcare. Okay, obviously had I given it the actual information, it would have been even better. Got some nice pictures of doctors here. I can say that what I really appreciate and enjoy about Gamma is the fact that what takes me a long time is not necessarily writing the text for the slides, it's just like it's the design and putting the pictures in the right place. So this makes it really easy for me. I've kind of got the structure and design. I can play around with it if I want. I'll show you how to do that in a minute. But just having that like initial putting my ideas into visual format is something that's very hard for me. It takes me a long time. So just having this as a baseline, even if I edit it and replace it afterwards, is really, really helpful. As you can see here, kind of. Yeah. So let me show you a few things. So first, let me show you how you can edit this. So first of all, with text, you can just edit it. But let's say the image, okay, let's go through and find an image we don't like. Okay, this image I don't like so much, it just looks like a document. Okay, so what I do is I click on the image. I then can go up here, that's edit this image. And then what happens is there is a pop-out here. I can either, if I want to upload one of my own images from my computer, I can go ahead and do that. If I want to try and find an image from the internet, I can go ahead and do that. But what I like to do is I actually like to go ahead and I'll prompt a new image on the spot. So I'll write image showing participants at an AI training. Thrilled to be finished and go home. All right?
We also put here infographic type of image.
Yeah.
If we ask.
For sure. I don't, images, so we didn't talk about this. Image creation with AI, it's a lot harder to do it in an accurate, it can be very creative. It's not very good at accuracy. So if you're, don't try to use AI image generation, let's say, to create a realistic model of the anatomy of the body, okay? That would be a very bad use case for AI images, because it's good with creativity, it's not good with exact scientific features. So yeah, that's. There's probably plenty here that can be done. The point here is that I wanted to show you is that you can actually, if you don't like any of the images, again, you can upload your own, or you can, there's a lot that you can kind of, you can play around with here in terms of the style. Okay, now it's generating a new image for me based on my requests and specifications. Okay, a bunch of men drinking wine together. Not sure how my prompt led to that, but okay. Yeah, exactly. It does not realize that, I think, what is it, like 60% of young scholars are female? Anyway, you need to teach it a little bit about academia. Yeah, that wasn't so super successful, but we obviously would have to sit and think about what the prompt is, right? Like I always say, it's all about the prompt, right? A good prompt, make all the difference. A bad prompt just gives you generic crap like this. So it's got some nice, this is a nice infographic here that it gives me. And if I wanna, let's say, so I can present just straight from here. When I teach, like when I've been doing this over the last few days, I don't download it to PowerPoint. I literally just go straight from here, okay? I find it easy. I don't have to start worrying about conversions, etc. But if you do want to work in PowerPoint, it's very simple. You just go up right next to the present, you go to share. In share, you go to export, and then you can create it as a PowerPoint file, as PDF, Google Slides, PNGs, however you like it. Sorry, yeah, and then send it to your email, that's fine. But again, it's got basically all the capabilities of PowerPoint, so I don't know that you even need to do it, but if you want to, you can. Yeah, so I find that this saves me a lot of time, really. Like, it would have taken me this kind of presentation, let's say it takes me another hour to edit, revise, put in new pictures. It would have taken me 6 or 7 hours to make this on my own. Now it'll take me an hour and 15 minutes. Okay, that's a very big time savings, especially for a tool that at least you can experiment with for free. You can put in videos, images, all the things that you're used to being able to do. Yeah, there's also charts and diagrams. That can be very helpful for you. For academics, you can just slide this in. I want a bar chart here, and you can start making a bar chart as well. So yeah, very cool stuff.
Avi, I remember in November at your master class, I did 2 presentations for my 2 classes, and I was in a rush. I was very stressed because I had lectures just after your session, and I did everything in 15 minutes. I was so happy. Yeah. You survived.
I'm glad to hear, and please, if you have all of a sudden tons of free time now that you, gamma.app, .app, yeah.
Okay. And you have to sign in or just
You have to register. So you have to register via Google or give them your email. All of these tools you have to register. Almost all of them you have to register for. Again, I think it says it up here. Where does it say?
But the free version only have 8 only 8.
So there's 2
slots.
restrictions. Yeah, 2 restrictions to the free version. First of all, it'll only create 8 slides at a time. Okay, so if you want to teach, and have 50 slides, it's not going to do that for you. Number 2 is I believe you start with 400 credits, and then every presentation, if I'm not mistaken, is 50 credits. So quick math, right? You get like 6 presentations out of it. So, just be aware that it won't last forever. I'm pretty cheap, so I have a few different emails, and I'll just create different presentations from different emails. That's probably not how you're supposed to use it, but if you want to, you can. It's just per email. So if you have one institutional email and one personal email, you can get double the amount. Yeah, exactly. Correct. You just click it again, and you can take it from here. Okay. One more point about Gamma. You can create gammas in other languages. Okay, so I encourage you to experiment in Georgian. I know with Hebrew...
I did it and it worked.
Does it work? Okay, great. Even when you download it as a PowerPoint, it works? Great. I'm really happy to hear that, because in Hebrew, it works like on the Gamma itself, and then when you download it, the words get all mixed up. So I'm happy to... If that's not the case for Georgian, then you're lucked out, because that also can save a lot of time. In general, by the way, we didn't really talk so much about languages, but in general, most large language models you can communicate with in any language. Okay, that doesn't necessarily. Not all tools can give you the answers in another language. Depends on the tool, but almost all of them you can communicate in whatever language you're most comfortable in. So, as far as I can tell, it doesn't impact the quality of the outputs. It's not like if you read in Georgian, it gets dumber. It may have less materials at its disposal in Georgian itself, but it's not any less powerful. Okay, I really love Gamma, so if you want, I invite you now to go ahead and think about think about a lecture that you've got coming up that you've been pushing off and that you really need to get working on, and try it, and I would try it again. If you have your own materials, I would try uploading those materials, because that'll save you time. Great. Excellent. Fantastic. Wonderful.
I hate Gamma.
You hate Gamma? Oh no, why? Tell me.
Yeah, there's of course the part of having limitations with it. It goes very improvising, and it's also...
It goes very what? Sorry?
It's improvises.
Improvises, yeah.
I know what I want to have on my slides.
Okay, that's a good point.
And there's, of course, it's a good point that, for example, it has so many, it split the themes, like one slide could be like, just like hardware is small information, so dedicates too many slides for the small information, and you don't always have this library. Editing this created PowerPoint takes me more time, so I was thinking to use other tools. So my question is, for example, infography is very highly marketed, promoted, and what do you think about the other platforms?
Yeah.
Like infographics are very useful for me, because presenting the different statistical and analytical data in a digestible and visually acceptable way. So I was thinking first there's other.
Yeah, so let me try and unpack that. First of all, you're right, it is a bit creative. So if you already have the exact language that you want, actually Gamma doesn't do a good job, because it starts giving you its own ideas. So that's a good point. I know my wife had her presentation already, and I tried to convince her to use Gamma, and she's like, no, but I want to say exactly this. So on Prezi that did work. Okay, there's a different cool tool called Prezi where it did work. The graphics there weren't nearly as nice, so whatever, it's a trade-off. I would distinguish creating PowerPoints from what you're saying, talking about actually creating graphs like infographics. There is a tool, if I'm not mistaken, called Graphy, which I tried, which is really cool. So that kind of combines the best of data with the visuals and visualizing that data. So if that's a big part of your job, then definitely choose Graphy, but it's not, it doesn't create the whole PowerPoint. It's just to create individual, yeah, we can look at it. I'm not an expert on it, but, and I'm always careful. I don't want to overwhelm people, right? I don't want people to be, but it's helpful? Okay, so let's see here. Here we go. Let's just make sure this is right. Okay, so let's look at Graphy. As I told you, almost every question, is there an AI tool for it? Then at least someone's working on it, right? If it's something that's a big enough market, it depends on the market at the end of the day, right? If you're asking me if there is a tool for historians to look at archives, the answer might be no. It's not a big enough market. There needs to be a business case around it, but if there's something that there's a business case around, almost definitely, you know. Okay, make me answer all these questions. Okay, free. Alright, so what I would want to do here. So what we'll do is, let's try and take the Excel that we were playing with before for here on poverty. So I'm importing this Excel. So I need to pick which sheet I want to look at. So let's look at the data sheet. Didn't do much here. 1 second. Let me move this here. Okay, so AI. If you click on the AI button here. I'm not sure why it's not. No, it seems like it froze. No. Let me try it again. Yeah. Okay, the page is unresponsive. Let's try this again. I think even the computer is tired at the end of the third day. So many tools, it's like, stop. Here, okay, it's giving me a hard time. But I do encourage you, when you have some time over the weekend, go ahead and try out Graphy. Again, just like we saw with Julius, you have to be very specific, but don't overwhelm it with information. Be clear about what exactly you want to create a graph around. But it's really cool. I mean, you can do, you know, column graph, bar, line, heat map, all sorts of stuff that you can do, and it can take it straight from your, okay, it's really quitting on me now, but you can take it straight from your Excel, CSV, Google Sheet, and turn it into really cool infographics, but that are accurate. This isn't, right, not AI that's just going to make a nice picture that, right, has nothing to do with what we wrote, but something that's actually based on our data. So I encourage you to experiment with that. Yeah, with that, I think that's the last tool for me to share. I will share for anyone that's left. You're going to get a recording. I will send you everything that I've taught. I'll send you. I'll send to Eka, and Eka will pass it along. If you want, the other way to kind of access this content, if you're interested, is if you Google AI Tools Bootcamp, okay, for researchers. So, okay. So it's this one. It's the Academic Language Experts AI Tools Bootcamp for Researchers. Okay. You can actually just register, put in your information, and then I have recordings of all the different tools that I teach. So it's kind of like, if you want to do, if you want to be like, what did we learned about quantitative research, also qualitative, which we didn't get to. I've got a session there on that. You know, so you can just go in, and it's just a library, free library of resources that you can access at any time that you want. So feel free to go ahead and do that. Again, that's all you need to do is Google AI Tools Bootcamp for Researchers and look for Academic Language Experts, which is the company that I run. I'll take this chance to thank Eka, to thank all of you for a wonderful 3 days. It's been really, really enjoyable. I know there's a lot of information. If you're feeling overwhelmed, that's very normal at this point. You know, we're all learning this together. Don't imagine like, oh, everyone must know how to use all these tools. We're all experimenting together. Pace yourselves, 1 tool a week, you know, set aside a half an hour to try and learn a little bit. But I do believe that many of these tools will help us transform research in ways that we can't even yet imagine. So good luck to you on your research journeys and AI journeys, and thank you for the warm welcome.
Thank you, Avi. And to everyone, because we had a really very magic 3 days. It was a lot, but lots of good. And yeah, what we learned really very interesting magic tools. We learned how to integrate these tools into our traditional research methods. We had very interesting discussions, including yesterday's panel discussions, right? We talked a lot about ethical issues. We talked about, I don't know how many tools we discussed. I did not count it.
At least 10.
Yeah, at least 10, but there are tons more. And we had this like very exclusive opportunity to have you, because I think that was something really very innovative in our real life, in the life of Georgian researchers, because we had the chance to quickly go through the research processes. We had really reviewed how it is, what is its key components. We did not cover in depth everything, but still we covered in general most of its part. And we had the opportunity to work practically, like having real exercises with you under your supervision. And I think that we still will continue collaboration in the future, because yes, as we have these kind of events, and yeah, AI is also evolving, so every day something new happens, right? And yeah, there is always something more to do. As for the materials, I am pretty sure that you will need something tangible to take away out of this 3 days event, right? What we have, what we can offer. First of all, we can offer presentations if our professors don't mind, but I'm pretty sure that they don't mind, because they are teachers and their mission is to teach you. And yeah, we are very generous to share the information and to support this learning process. I know how generous Avi is, because he always provides his prompts, his tools, list of tools, and many interesting sources, written, documented version. So we will also have recording of these 3 days sessions, and later we will think how to make the best version of this recording to support the teaching process in the future. We will also have short 1-minute videos, like TikTok style, out of this arrangement, in order to give you quick understanding of the research and AI together. And we already did this recording, and thank you for that again. And what else? Yes, so you see here the QR code, which is the evaluation form of this whole masterclass. Please don't be lazy. I know that you are very tired. It's the end of the 3 days event, but go there and yeah. Oh, great. Because your feedback is really crucial for us. What to improve, what to consider for the future. Even we will share this feedback to Avi, because I know he is always interested in improvements. And anything else? Maybe no. And yes, so we have finished here with the research masterclass, but we continued the whole week with other events, which are also, then they are quite interesting. I will briefly introduce the topics of the next events. So tomorrow and day after tomorrow, the sessions will be dedicated to self-presentation and self-development and communication for students, for those who look for job opportunities, and we'll have very exciting meetings with HR leaders of our very large employers in healthcare. We will have also international experts in HR, and we have the very well-known expert from Chicago, Ilan Gevam, who will teach us storytelling, who will teach us public speaking, and who will teach us how to present ourselves as a pitching, just within the elevator speech, and many more things. How to promote your self-branding. I encourage you to use this opportunity because it doesn't happen frequently in our lives, so use that opportunity. And day after, tomorrow we'll have just the practical event. I mean, the whole lobby will be busy with the practical work on our CVs, on our real-life interviewing process, and yeah, so that will be very exciting, very interactive, and we'll have here again HR leaders, we'll have students and student service representatives from different universities, because we also work with student service departments to improve their opportunities to work with students, to support their career development. So, and finally, on Saturday we have the conference where we will have the leaders of clinics, hospitals, will have leaders of academic institutions, will have students telling their stories to us, and we'll have also the award session for our winners in blog competition, academic blog competition. And we will also work on how to create our future, collaborative future with academia, with employers, and with students and alumni, and that will be very creative work to do these future plans together. So that's, oh yes, and on Sunday there is employment, I mean the labor forum happening here just in the lobby. We'll have about 14 or 15 employers, big clinics, and we are inviting those who are seeking for a job, students, not only job but also some so, and yeah, so that's, we have a very busy week now. And all of you are invited. Use these opportunities, and thank you so much being part of everything. We really value this collaboration. Now enjoy your evening, and we are in contact. Thank you.